Welcome everyone to our November 20th DCYF Oversight Board meeting. And really want to thank everyone for joining us today. And I think the last time we were together, we were actually together in person. And that's the first time in a long time with a full room. Had great conversation, and it was really nice to get to know newer board members and to have some opportunity to have some conversation and to think forward. So today, we have a variety of things going on, and it's a full meeting. I know that Elisha has sent things to the board. Hopefully, folks have had an opportunity to preview some of those things. And if not, you can learn as you go. It's always an opportunity to ask questions and wonder aloud. So the first thing we're going to do today is we'll have a Q&A about Department of Children, Youth, and Families 2026 decision package and agency request legislation. And that is going to be done by Julie Watts and Brianne Boggs, both from DCYF. The second thing we're going to do, which has been a focus and an interest of the board, I know, is a second Q&A session with Vicky Ibarra and Jenny Hedden from DCYF with a focus on critical incidents, and also on Senate Bill 6109, which was a bill that was passed related to the fentanyl response for children and families. And so we'll hear a little bit more about the more recent updates, I think quarter 3 and 4, or 2 and 3, I can't remember, but we'll hear more from them. And then Elisha will lead us in a conversation around next steps based on our conversations and decisions that were made at our recent retreat. And we'll also look at the bylaws and think about board representation. And then we'll have some time before we end looking at the draft statute, which is now in a form, hopefully, that we'll be able to discuss, and about proposed name, and also about a proposed name change. So looking forward to those conversations and input from the board on that. And then final agenda item is related to chairs and potential extensions, and also hopefully a board meeting debrief, and we can see what people learned, what they still want to know, and what we need to do next. So before we begin with all of the heavy stuff, first we got to figure out who's in the room. And we also need to approve the October minutes. So Elisha, I'll pass it off to you.
Wonderful. Thank you so much. Good morning, everyone. For the board member roll call, please unmute yourself and let me know that you're present when I call your name. Judge Sharonda Amamilo.
Present.
Good morning. Anna Armstrong.
I am here.
Hello. Representative Steve Berquist. Katie Byron is absent. Bobby Bridge.
Present.
Good morning. Senator Leonard Christian is absent. Representative Tom Dent.
Rep Dent's here.
Good morning, Rep Dent. Dr. Ben DeHaan will be joining us later. Dr. Marion Harris is absent. Pamela Javier.
Here. Oh, I couldn't. Can you hear me?
I can. Good morning.
Okay.
Danielle Johnson.
Here.
Wonderful. Ruth Kagi will be joining us later. Dr. Diane Levy.
Hi, I'm present.
Wonderful. Lois Martin will be joining us later. Tanya McClanahan. And I have a note here that she will actually be joining us later. It's a busy morning for lots of people. Mary Spruti Garlant. She also emailed that she will be joining as she is able. Stacy Williams. We might want to check if she was able to participate. She did email earlier.
Yeah, I was just on the phone with her. She's just getting in. She should be in the meeting.
Oh, thank you so much, Nicholas. And then
Hi. Wow, I was in the void. Sorry, guys. It's like,
no problem.
oh,
Good morning.
come
So
in.
great to see you. I'm going to keep going with roll call.
Okay, good.
Shelley Willis.
Shelley Willis is here.
Thank you so much. And finally, Senator Claire Wilson.
Present.
Wonderful. So I'm just checking my list, and if anyone could help me, do we have quorum, which would be 10 or more people?
I see Representative Berquist on the actual, in the actual panel. So I don't know if he's present because I don't think he responded present.
Okay. Representative Berquist, are you here?
I am here. I am at the bank getting a little work done, but sorry, I'm trying to multitask.
I completely understand. Glad that you're able to join. Thank you.
And we are at quorum with 12 members.
Wonderful. Thank you so much, Nicholas. So now that we're at quorum, I'd like to request that the board consider approval of the October 29, 2025 meeting minutes. The minutes were recently edited to add a member who was mistakenly left off the attendee list. Does anyone have any additional edits or feedback to the minutes? Is there a motion to approve these minutes? Oh, Diane?
I would just say I want to thank both you and Nicholas because that must have been a very long project to do those minutes. So thank you for doing that.
You're welcome. It was indeed a team effort. So is there a motion to approve the minutes?
I move to approve as amended.
Thank you, Shelley. Is there a second?
I second.
Wonderful. All in favor, please say aye.
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 All opposed, say nay. Any abstentions? Okay, with that, the minutes are approved. Back to you, Senator Wilson.
Thanks so much. Thanks, Lisha, and thanks everyone. And again, my thanks too to both you and Nicholas for kind of putting all of our words on paper, because boy, that was a lot of words that we spoke. So really appreciate that. Now we're going to move on, and I have the pleasure of welcoming, and I see Brianne, but is Julie coming too? So she may be here, but she may be popping on. But I have the pleasure of both welcoming Julie Watts and Brianne Boggs. Both are from DCYF, and they're here to answer questions around the DCYF's 2026 decision package and the agency request legislation. And before we actually are going to jump into asking questions, they're going to share a few slides to help us kind of ground ourselves on the topic. And there was a video that hopefully you had a chance maybe to look at, which was the webinar around the decision package prior to today's meeting. And again, if not, this will be your first blush, and you're welcome to ask questions. So without any further ado, I am going to ask Brianne and Julie if she's here to unmute and take it away.
I'm unmuting. I'm Brianne. Nice to meet you all. So I do have the PowerPoint from, it would be from the webinar. So that's our kind of our main shared resource. So
That's going on. Maybe what I could at least explain is the two things we're going to look at. One is the decision package, and one is agency request legislation. And a decision package is really around budget and around money. And agency request legislation is around policy and legislation that there we go. See, I knew when I started you'd have time. Go for it, Brianne.
Okay, thank you. Hopefully Julie pops on here. I'll do my best if she doesn't. So I'm the Deputy CFO for Budget, Rates, and Forecast at DCYF. And Julie and I work really closely together on DPs and ARLs. I don't think I need to remind you all about this process, just seeing who's on this call. I think you're fairly familiar with where we are, and we're in the fall time period of the actual supplemental budget request process. So we've submitted our DPs and they're currently with the governor and OFM going through review, lots of Q&A, and we're anticipating, you know, by I think it's December 20th, I forget the statutory deadline, that we'll see the governor's budget come out. There were some guiding principles as we thought through our 2026 supplemental decision package. Going into this process, we knew that it was going to be a tough budget situation already, signaled by the reductions in the 2025-27 biennial budget, but also in the economic situation in the summer. So there was quite a bit of prioritization that occurred as we worked through decision packages, trying to ask only for what we absolutely thought the agency needed. Lots of mindful thinking around that, focused on the core responsibilities in our DCYF's vision and strategic plan, and prioritizing decision packages that were focused on legal obligations that DCYF needs to meet, and also resources for staff that we considered essential for safety and well-being of children, youth, and families. So I already mentioned we went into it knowing what the budget realities were. First, that it's a supplemental budget year, which usually means smaller decision packages, not major overhauls, tweaks to funding that we've already received, or signaling that we'll have a bigger ask coming in the biennial budget. Also understanding both the state and federal government realities, which have evolved quite a bit since we submitted the DPs following up that 40-some day government shutdown. This is also the first budget build for this governor. So that's another change in reality to deal with as an agency, learning what this governor's priorities are and limiting what we asked for, really having a limited scope of our budget requests. So the first, our top priority DP, and you can see the prioritization of the DPs. This is actually submitted. Oh, did the slide change? Is it not changing? Are you guys still on the, can you guys tell me what you're looking at? Is it preparing for session supplemental budget year? Is that the slide that's still showing?
Yes,
Okay.
it's still showing that one.
You know, well, I'm gonna click through a couple because how do I get that to change? Why is that not changing? Shoot. Okay, now it's changing. Okay, I verbally said this, so I'm gonna skip through this slide and we'll share these slides too so that you have them. And this was the reality slide that I was just talking about. Okay, so our first decision package, or I'll say, let me try to restate. So we do submit DPs in a priority order that's required in the budget submission process. And so these are listed, I believe, in the priority order that we submitted. You can see it with the secretary's letter to OFM. So the child welfare workload model, you're probably familiar that I think it would have been back in 2022 or 23, there was a legislative requirement for DCYF to do a workload study. And this was a two-part study. There was the public consulting group took the first iteration. And then from there, we had internal work under our child welfare team to do a time study and to update the work that PCG did. So that child welfare workload study, the report is currently, I believe, with OFM and Gov still. I don't think it's been publicly released yet, but it's under review. But this decision package is based on the recommendations of that report. So what we're asking for here so currently at maintenance level, DCYF is able to request CPS, Child Protective Services, Family Assessment Response, Central Intake, Clerical, and Supervisory Support. And as a maintenance level step, this is not often viewed by the public, but it's in RCW, and the Caseload Forecast Council projects a caseload that we then use to come up with our maintenance level workload step. So what this decision package is doing is saying, we'd like to adjust the factors and variables, how we currently calculate our child protective services, our social workers at our maintenance level step. So we took that model and we updated it based on the recommendations of the workload model. I'm sorry, I don't actually have that detail right in front of me, but some of the factors that we adjusted were the number of hours available for a social worker to do their work, and also what their caseload should be and how long they have to complete their caseload. So when we made those adjustments, that resulted in 426 additional child welfare staff that we believe we should be receiving at maintenance level. But given the reality that we talked about, the state and federal economic realities, we phased this request in over a 10-year period in order to make it something that could be purchased over time with this supplemental budget, starting with the supplemental budget. So what that
I'm sorry,
results
what's
in,
yep. I'm so sorry. What was that number again? 436?
426 is the result of the actual workload model. It essentially said, based on the number of cases coming in, the complexity of the cases, looking at your current authority, and what I mean is your current number of workers that you have to do the work, that there is a need of 426 additional workers. And that is actually not including all the workers. We trimmed that to only focus on CPS, family assessment response, intake, and then clerical and supervisory staff that go with those workers. So we took that lower ask and then we requested to phase it in over 10 years, meaning we would come back in with a budget request over time, trying to buy down what that workload study recommended. So what that buy down looks like in this request is 9 FTE in fiscal year 26, but please remember fiscal year 26 will essentially start in April or May because this is a supplemental budget. That's how long it'll take to complete a budget. And then 41 FTE in fiscal year 27.
Thank
I
you
see
so much,
Alicia's got
Brianne.
her
I
hand
think
up.
Julie might be, oh, I'm sorry, Senator Wilson. I think
No,
Julie
I
might be
just
here.
see you had your hand up.
Julie, are you on the call?
Yes, I am. Can you hear me?
We sure can. Welcome. Thank you.
This is Diane. I just wanted to ask, do you want questions all along or do you want to wait till the end?
Right.
I think that's a good question. And I was actually going to say, really, our hope was that people have been able to watch our webinar and that we can really use this time predominantly as a Q&A opportunity to talk through. And so then maybe we can go to the slide as you all have questions. But we really want to, we know we have a shorter time today, so we really want to make sure that we're just answering any questions you guys might have.
Perfect. Then I will stop giving this detailed presentation.
Yeah. And
obviously we've been talking about deep.
I think this one will be quite popular, so happy to spend some more time on it. So yes.
Yeah.
So
Jenny, do you want to do kind of a frame, if you will? Anything else you want to say before we do that? Because I think we got to set the stage, if you will, for the board and kind of how you want to move forward, whether we ask questions slide by slide or whatever. I also see Danielle had her hand up.
Yeah, Senator, I think just in terms of how we can approach, certainly, and Dr. Levy, feel free as chairs to direct us. But just want to, for the framing purposes, as Brianne sort of stated, obviously it's both a supplemental year and a year where there is a challenging budget situation. And so we were very mindful of that when we asked for our decision packages. Our two kind of big FTE driven ones are this child welfare workload model. We also have a JR investment on starting to fund a workload model in JR as well. So those are sort of our two large FTE requests. And then we also have a request in sort of around critical incidences, which we're happy to talk about in the next section. But happy to sort of stop. And I know this one again is probably going to be a highlight for folks, especially with the board's interest in sort of our staff, et cetera. So happy to answer questions about this one.
There is a question in the chat from Shelley Willis. Shelley, do you want to ask your question?
Well, on a much smaller scale, I know that changing workloads and bringing on new staff hit other areas of our budget, like our computer and technology area. And I just wondered if that was already folded into the request or that's expected.
It's a great question. So we have funding right now, as I think some are aware, to redo the data system that our child welfare workers use, right, which is currently called FamLink, and we're calling it CWIS, although we're in the process of naming our next system, because CWIS is really just the comprehensive child welfare information system rules that the federal government have forward. This particular workload model right now assumes essentially the current data system. We will need to redo this when we have our more modern system, because we believe that that more modern system should result in the number of hours that our staff are having to spend on the computer should go down with a more modern system. But we right now have this workload study based upon the time it takes to do tasks in our current data system, if that helps answer the question.
Well, kind of. Does that
Okay.
include the training and all that goes with that on this new system?
So the training and all of that will be sort of a part of a secondary ask for our child welfare for that information system. We just signed contracts and got our plan in place for introducing that new IT system. So we won't actually have that new system on the ground for probably another 3 years, 3 to 5 years. So that will happen in the future. One of the big changes that underpins this workload model is a change in the assumptions around making staff be able to have more time for engaging in all sorts of training, not just for the IT system, but also for more generalized training as well.
Thank you. That answers.
Danielle, I think you had your hand up.
Yeah, I actually have a couple of questions. So I heard that some of the recommendations that were considered when rolling out this proposal based on the workload study, was it taken into consideration as well, the supervisor ratio? Because I believe right now it's like a 1:8 or 1:9 ratio, and the recommendation was 1:5 or 1:6. So is that included in this package over the next, or phasing in these people over the next 10 years?
Yes, so we are changing the supervisory ratio. We actually largely, and I always am hesitant to promise, because I know, like, right, things change, people move on, and so in any given particular office or particular unit may be having a different sort of experience. Brianne, just so you know, we have your whole screen. This should reflect that different ratio change. When we looked at this recently, Danielle, we actually had many places where we were really close to a 1:5 ratio for supervisors, so that supervisors were not having any more than 5 staff. And happy to sort of share more information with the board about, like, what does that picture look like now and how far away are we from being able to achieve that on the supervisory side of the house. Obviously, as we add more staff, then you also have to add more supervisors, and that is what this model does, which is it essentially locks in that ratio. So that suggestion was taken.
Yeah, and then I apologize. Like I said, I have a couple of questions, Jenny. So did it also take into consideration kids versus cases? Because I know that tends to come up a lot with workload versus caseload, and it's not like a direct, like, one-to-one situation. Sometimes it is, which can be great for the worker, but sometimes it's a family of 8. So did that come into consideration with determining this?
I think some of that's going to be a challenge in our current data system, to speak to our current data system, because I think obviously, Danielle, as you're aware, and hopefully maybe other board members are as well, but if you're not, that typically what happens is that in our intake numbers and our CPS numbers, we are looking at those as families, and so there can be many children, obviously, in those situations. And so I believe that what we're proposing to do here is actually handle some of that in case weighting. So there's this whole kind of issue of, like, how a case is not a case is not a case, right? And then so how do we have particular types of case weighting? And that's one of the pieces that you will see also in the workload study is a discussion of which types of cases should be weighted more heavily. And larger family cases, we have talked about potentially having a weighting system. I think what will be challenging is the way our data system works. because we currently characterize CPS as a case is a family, that I think we will get into that maybe possibly through case weighting as opposed to having those be individual cases. But definitely, I think the devil's going to be in the details around implementation. This is obviously the model and the math, and then we have to figure out if we get funded for it, how we actually put that on the ground.
Gotcha. And then one last question. How will distribution of the FTEs be determined? So like, for example, Region 4 King County was over our FTE allotment a couple of months ago, and we were looking at eliminating some positions that were non-case carrying, but we were still overfunded or over the funding for our FTE allotment, just based on the ROG. So what would that look like, and how would those sorts of things be taken into consideration if there's offices that need CPS, CFWS, frontline workers, but on paper it does look like we are over budget for our FTEs?
Yeah, it's an excellent question, and I think one that I may also offer, just because I am conscious of your time, and we have other decision packages and agency request legislation. We actually are planning a presentation on our workload study, both internal and external, and I can grab those dates and put them in the chat for folks. I don't have them off the top of my head. So I think that might be a place where we can dig into some of this. The way FTEs are allocated right now, part of the problem is that we essentially have a limited pie. The pie does not grow based upon how many cases we have, etc. And so what we have to do is take that one pie and split it up amongst the 6 regions right now. So when regions are experiencing changes in sort of workload, we do have a methodology heavily weighted on the number of intakes coming into a particular region as the way that FTEs are distributed across the 6 regions. If we were sort of more automatically funded for this workload and actually had enough FTEs to represent the work it takes to do high quality social work, then I think you would see a situation where the FTE distribution between regions and between offices would be far more fair, and would actually have some relationship to the amount of work that's coming in. Right now, we're just taking a pie that never grows or doesn't grow very quickly and dividing it like between 6 people, which means there's constantly winners and losers. What we would like is sort of a more all winners situation where you're infusing additional staff into the model. And that's really why you see the ask for additional FTEs. But I will encourage folks to maybe come, if you want to do a deep dive on the workload model, to come to one of our webinars, because we will be covering this in much more detail than we have time for today here.
Great. I want to be conscious.
Really good questions, Danielle.
Yeah. I want to be conscious of our time too. And I know if people have actually looked at the video, there's, things related to JR. There's not only agency requests, but there's also capital requests. There's also information around working connection subsidy and early learning. There's litigation staffing. There's licensing fixes. So I'm curious if there's any specific questions, or whether, I don't know if we're going to have time to go through every one of the slides. That's my concern. So just curious what's top of mind for folks, what you want to dig in more about, what you'd like to know, since we've got folks in the room. Stacy, you are muted. So first thing, we got to find your unmute. Still can't hear you. Nope.
While we're waiting for Stacy, would it be possible to consider some of the asks for on the critical incidents? That's, I think, the next slide. And I know that we're going to have a session to follow about some of that, but I don't know if there's any questions from the group specifically for that, on that area.
Were there any specific, it was a DP, was there not the DP related to critical incidents? And so maybe Brianne or Jenny, you want to speak to what might be there?
Yeah, Brian, maybe it would be helpful if we could share just the critical incident slide. And then also I know Julie's on the phone as well, and I'm sure can give additional. And then just as a preview of coming attractions, Dr. Vicky Ibarra will be joining me up next to go kind of deep dive on critical incidences as well, but we can at least cover the sort of basics of what's in the decision package.
And Bobby, while okay, here we go. I was going to say we're going to use a good use of our time.
Do you guys want me to talk about it high level?
Well, is there particular questions? Yeah, before we go through the whole thing, just does anyone have top of mind, or do you want the whole? Diane, do you have any
Well,
particular?
To me, this looks like funding for a 6109. Basically, the things that had been put forth in 6109. Is that correct, or is this how would you look at that?
Some of the things in this decision package were things that were funded in 6109, but the department received one-time funding through opioid settlement dollars for those, and kind of at the same time that the opioid settlement dollars, we were just about to roll out some of these contracts. There was a directive from the Inslee administration to pause on certain contracts. And the department made the decision to press pause on these decision package, that particular funding for a couple of these things. So we are requesting these to have these dollars ongoing but there are other elements of this decision package that weren't in Senate Bill 6109 that are really more about kind of tailored to the situation that we're seeing in critical incidents, which is often that at the time that DCYF is involved in the case, the family is not participating in services and not agreeing to services. And we're not seeing an active safety threat at that time. And we need to close the case because of the statutory timelines for case closure. So, what we're proposing here is some kind of to pilot in in a few regions that where we see high numbers of critical incidents or seeing big jumps in critical incidents, the ability to kind of have a referral that we can make prior to case closure, that warm handoff to community-based resources to continue to follow the family post-case closure. We know that it is often difficult for families when it's CPS, when it's the state, when it's government investigating them. They're less likely to agree to services than when there's kind of a warm handoff to a community-based organization who they may feel more trust in to be able to kind of follow them and continue to provide supports and services to them after DCYF has closed the case. So there are some new elements here that were not in 6109.
I'm sorry, could you tell me which one of the bullet points that refers to? Is that the
public health?
So
the plan of safe care, I think.
Nurses, yeah, and I'm not looking at the screen. Unfortunately, I'm on the phone, but the referrals to plan of safe care and to family resource centers are that
community
kind of
pathways referrals prior to closing. Yeah, got it. Sorry.
I see. Diane, anything else in particular around this? And again, we're having a whole presentation on critical incidents next. So if it's around the DP or around agency requests, I'll also add that advocates and supporters also are doing some work with related to keeping families together, 1227, which is oftentimes comes up with this same piece of legislation. So I think on all sides, we're continuing to think about how we support kids and families. that need us, and especially in these tight times. So really appreciate that. Bobby, what is your question?
Thanks. I wanted to just ask a question on the JR decision package, because I know we're not going to have time to go over it much. And frankly, I read it really quickly too, but I'm looking at the Community Transition Services, the CTS section, which is, of course, designated in part as a way to reduce population, confined population, that is to say. And if in like a couple of sentences or so, I know it's going on the caseloads potentially of the folks who are doing parole. How is it related to or not? Is it an earlier version of parole? I see that it involves electronic home monitoring as well. Just kind of a high level conversation a little bit about that and how it's come into the mix of options for reducing population, confined population.
Yeah, so CTS is offered as while the individual is still completing their adjudicated sentence. And
Right.
so it would count sort of in the same vein as institutional setting, community facility, and then ultimate step down would be that community transition.
Okay, so it's in sentencing, but how practically for what's going on with the youth does it differ from parole?
Than parole. Well, so that we do have electronic monitoring of the individual. They have more restrictions in terms of the types of, behaviors that we could potentially be seeing, right? As opposed to, so if somebody's on parole, there is a standard that they'd have to, if they violated their parole, then we would potentially revoke them back.
A reporting requirement, in other words.
Right.
Yeah.
Exactly. And so for CTS, because that person is still in their finishing their sentence, there is much more significant limitations on where those young people can be, right? They have to, again, I think if you're familiar with electronic home monitoring, very similar in terms of there are specific locations that you're allowed to be in. There's much more restriction on you because
is it a congregate care anticipated?
No, you are actually yes, you are living either returned with your family, or if you're, older and you might be also getting housing. So part of it is the sort of wraparound that we offer is very similar between community transition services, parole, and we also have a voluntary aftercare program. So you're probably largely eligible for the same types of services, but you have much more intensive monitoring happening of you if you're in that CTS program. So they could be in a congregate care setting, for example, potentially, but likely they are actually returned home or living in like their own apartment, that kind of, those kinds of settings.
That's great. Hopefully you could spend a little time with our subcommittee on JR, because this is kind of a unique thing. Thanks.
Absolutely. And we are adding the ask there for CTS is just adding additional staff because that's really the limiting factor right now. We actually have young people that might be eligible for the service that we cannot serve.
But can't serve.
Because we don't have the staffing necessary to have that kind of high degree, high touch monitoring that we have requirement for in CTS.
And they're contributing to overpopulation, right?
I mean, to some extent, right? Obviously, they have to be eligible for either, for stepping out of that restriction of being in the institution, which means they'd have to meet that institutional minimum, qualifications, which is about time served and your behavior in general, and the types of crimes may limit you. But it is certainly looking forward to being able to use that more, and not just to reduce population, but also, obviously, we think it's in the best interest of young people to be able to have that opportunity as well.
Thank you.
Shelley, we're going to go 5 minutes over. Now we're going to go 3 minutes over because we're already 2 minutes over because we don't have a lot of public comments. So we're going to use some extra time. Shelley, all yours.
I'll be quick, but I want to ask for graces. I'm still catching up to the acronyms. You guys speak a different language sometimes for me. Where are the crisis areas? So you've identified critical areas across the state. What are those? And we have, as a PCAP, I love to see PCAP in there because they're working really hard. However, we've seen the plan of safe care roll out rather slowly from the hospital's end. I mean, we're in October now and still not launched in all of our areas. So I'm curious, is there pilot projects considered for this Family Resource Center high needs and for plan of safe care?
So I think you asked a couple of questions there. One was about like what the crisis areas or high needs area that we'd be targeting. We have not made that determination yet, and we would make that determination a little bit closer to like actually being able to implement that. So there's a little bit more pending there in terms of like when we're actually closer to implementing, wanting to be nimble and monitoring kind of what is actually happening in terms of increase in critical incidents and where that's happening. In terms of there is a distinction between plan of safe care as terms of like hospitals making referrals to Help Me Grow. This proposal is a little bit different from that in the sense that we would be utilizing that community-based pathway not just when a child is born substance affected, but in situations where there was a CPS case involving a family with a child between ages 0 and 3. So this is utilizing that community-based pathway for a different population of children. So it's not just related to like when the hospital would be referring a family when we had a substance affected newborn. Did that answer your question? And in the next presentation, I believe they're going to be taking questions about critical incidents more explicitly. And so I might be able to take that up in the next section as well if you have further questions.
Thank you.
Thank you. And we are at 9:45. I do want to say though, we had an incredible thing happen last week, and that is a commitment from the Ballmer Group to invest $1.7 billion over the next 10 years for our state-funded pre-K program, Early Care and Education Assistance Program. And as we think about all things child welfare and we think about all things juvenile justice, we know our return on investment and our support for families, we would have different outcomes if we actually provided folks what they needed from the very beginning. And so there'll be 2,500 slots and additional children served this coming year, and that will move forward over the next 10 years. And my hope is that our conversations will always be an and both, but that we'll see much more opportunity for young people and for families when we think about it from the prevention angle rather than thinking about it from the intervention angle, which is what we tend to do and which really costs us a lot more money. But we also have things we've got to fix. And one of those things is we have this thing called critical incidents, and we have a very challenging public health crisis, not only in our state, but across the country. And so the next thing, first I want to say, Brianne and Jenny, and I see Julie on the phone too. Thanks for that information. And I would say if folks have actual questions or further questions around agency request or DP, to let us know, let Lisha know, so that we can follow up. And I know watching the video will be helpful, the webinar that was sent if you didn't get a chance, because that really does answer a lot of questions. It also has other people asking questions, and so that may be helpful as well. So speaking of critical incidences and speaking of DPs and agency request legislation, I next would like to introduce and welcome Dr. Vicki Ibarra and Jenny Hedden. And Jenny, we've already heard from, and I see Vicki here. And we've seen them both before, but today what we're asking them to do is to really give us some information on the Q2 and Q3 2025 critical incident updates, which I know was it was a concern for many folks when we saw the initial increase in the numbers come out. And their conversation's really going to focus on 6109 funding, and that was the fentanyl response bill that I just happened to sponsor a couple sessions ago, given what we know and what we knew and what we still know is a concern for so many people, way beyond, I think, what we've ever experienced before. So critical but challenging topic. And Vicki and Jenny, I'm going to ask you to just take it away. And thanks for sharing the information today with the board. And we'll go from here. You'll go from here.
Thanks, Senator Wilson. And just to kind of level set us, we are sort of hoping, I think, to do a sort of similar thing. So we have shared out in advance the webinar that Dr. Ybarra and Natalie Green, my Assistant Secretary for Child Welfare, did. So really kind of hoping to just be able to answer specific questions and go deeper if there's any of those topics that you want. I do have the slide deck up, so if there's any need for us to pull up any of those slides, we can also reference them as well. I think the spoiler alert, while people might be thinking about some questions that they have, is that we really have seen a moderation of some of the trends that I think people were most concerned about coming out after the passage of House Bill 1227. We believe that to be largely an effect of sort of the correcting effect that 6109 was meant to do. And so happy to have maybe Vicki answer or speak to that trend and what we're sort of seeing just very briefly, and then we can go into questions.
Thanks, Jenny. Yeah, happy to do that. And I've got those slides. I didn't want to plan to run through the entire deck because I know most of you have had a chance to see that on the website, but happy to refer to those pieces that might be most helpful. I think the trend Jenny was talking about largely is this sort of macro trend of entries and exits into out-of-home placement. This is trend data that our Office of Innovation, Alignment, and Accountability puts out publicly and updates regularly. Here it's by state fiscal year in order to try to align with about the start of implementation of these two pieces of legislation. So you see that if you focus on the purple line, that entries into care have been on a downward trend for some time since the beginning of the new agency. And this is similar to what's seen nationally. This is not necessarily unique to Washington. For many years now, there's been a decline in entries into care in many states. That trend on decrease of entries into care was potentiated and sped up because of COVID. It was also sped up after 1227, but overall has been on a decline for quite some time. What we saw with the implementation of Senate Bill 6109 and the opportunity, the direction to courts to give great weight to the presence of high potency synthetic opioids is we saw an uptick in the number of entries into care for the first time since 2017. And you can see there at the bottom portion, fiscal 24 to fiscal 25, that the number of entries into out-of-home care went back up to almost pre-1227 levels. So before the implementation of 1227, we had 3,300 entries into care in fiscal 23, and then in fiscal 25, we had 3,200. So almost back up to where it was before 1227. This leads us to believe that the 6109 had its intended effect of correcting that trend and accomplished what it was intended to do in terms of entries into care. The numbers, as Jenny said, have moderated. We were very alarmed with the number we saw in Q1 of 2025, which was over double of what we saw the previous year, first quarter. We attribute a lot of that to what was happening in Spokane at the time, but it was the statewide problem of fentanyl, as well as other issues that families are dealing with. We saw more medical related incidents, couple of terrible malnutrition related incidents, children with special healthcare needs not getting access to care they needed. So we think those are broader trends in the community. Those numbers have moderated quite a bit to 14 in Q2 and now 9 in Q3. And then you see the numbers there, the breakout of fatalities versus non-fatalities and the age breakout. Thanks, Jenny, for putting those links in the, I'm gonna stop after this next slide, just so you don't have to look at numbers all the time. This is another way to look at the trend over time in critical incidents. The 2025 data are just through Q3. We still expect 2025 to be a record year. So far, our record year is 2023, and we are up to that number already as of today. So we expect the 2025 numbers will exceed any previous year, and this should still be alarming to us because we are far above our usual trend in Washington State. And as I've said before, many times, this group of families is just a tip of the iceberg. They reflect the fact that we have higher need families across the state and in our child welfare system who are not getting access to the care and services they need, the supports they need when they are not with child welfare. So as you've heard me talk about before, we have a churning high need population in the front end of child welfare who aren't placed, tend to have lots of re-referrals, and that we're trying to get more supports for. We also have a fentanyl epidemic ongoing in Washington State. We have been able to work with RDA and the Healthcare Authority because we wanted to get a look at what's the bigger picture of opioid poisonings among birth to 3 children, and are we seeing most of them in our critical incidents? So those data are now available. We estimate we're seeing in our critical incidents probably a quarter to a third of all the birth to 3 opioid poisonings that are happening statewide. That doesn't mean the rest aren't getting referred to child welfare appropriately by mandated reporters. It just means they're not meeting the definition of DCYF reviewable critical incidents, so they're being dealt with in different systems. And we have good working relationship with HCA to take a closer look at those. But it is, as Senator Wilson said, a public health emergency that we see in the child welfare system. We see a portion of it, but of course the entire state is dealing with it.
Vicki, I had a question, and that was, we saw in the DP earlier around critical incidents, all the things that were not funded that were inside of 6109. You also just shared data that said because of 6109, you're seeing a change in a decrease. So what would be the change if we actually funded what was inside 6109, and how might that increase the downward cycle that you're seeing? It's hard to believe that. I mean, we did 2 things, I think, within 6109. One was the liaisons and the regional offices for the courts, and the other was administrative offices of the courts did training and created training for judges and such. But I'm curious, besides those 2 things, what else changed? And I'm just curious because that's an interesting statistic to see the decrease. And is there anything you could deduce?
Yeah, the decrease in the number of critical incidents, we do think the moderation of those numbers in Q2 and Q3, we do think is probably in part due to 6109. Only in that the 12-month look back, right? The DCYF reviewable critical incidents have a 12-month look back. And as of July 1st of this year, that 12-month look back period was fully after 6109 was implemented. Whereas in the previous quarters, that 12-month look back may have included part of before 6109 was implemented. So we think that's part of it. More children are being placed, more children with HPSOs in the environment are being placed, but these numbers do not indicate that they are returning to pre-2023 levels. They are not going down to pre-2023 levels. They are just not going hugely up. So we still have a problem.
Right. Thank you very much.
Yeah.
Other questions folks might have?
And I think just, sorry to dovetail.
No, go ahead.
To your comment, but I think, there's a real philosophical question I think that the state is wrestling with, and that all states wrestle with in child welfare, right? You can make systems that are very safe for children that remove a lot of children and can potentially impact well-being negatively. And I think this is where, Washington State is trying to sort of find its way. The other thing what I think we'll just note is that not only was there probably corrective effect, but every time we change these legal standards, there is a period of time for the entire system to sort of learn and adjust. And so we may also be seeing some natural moderation as people learn how to implement this. And that's not just on our caseworker side, that's obviously on all of our court system partners, our other partners that we have. And we don't want the only tool in the toolbox to be place or not. And that's why you see that decision package from us to increase the number of supports for these families that may or may not, ultimately result in placement. But we feel really strongly that those supports for families is the business that we should be in, right? So as well.
Just curious whether early ECAP was any conversation as you thought about your DPs, since that was not funded and that does cover support for birth to free population.
Yeah, Vicki, I don't know if you want to.
There are many prevention tools in our toolbox that we would have loved to have included in the DP. You'll notice that home visiting, evidence-based home visiting, is also not in the DP. We would have loved to include some of those other evidence-based programs like early ECAP, like home visiting, but didn't feel like we could load up everything.
Thank you. It's a tough time, I know, and it's really, there is no good answer for anything. And wraparound services and supports, I know, are so important. Other questions on critical incidents, 6109, or anything that's kind of connected to that? Diane.
Well, I always have questions, but one of the things I guess I'm wondering about is the sort of phrase imminent physical harm and how that's interpreted across the state. I would imagine, that seems to me like that there could be some subjectivity in what somebody is assessing as potential physical harm. And I wondered how you approach that. And are you seeing geographic variations? Are you seeing regional variations and how that is interpreted?
I'll let Jenny speak to the variation, and this would really be a question for our child welfare colleagues. I think they would say and have told us there is variation across the state. It's one of the reasons that the training that 6109 included is so important. We think there are still opportunities to improve that training for courts. And Jenny, I know you've been in discussion with AOC about that training.
I think what we saw, certainly, I think we see both, differences. And that's why I sort of mentioned that I think our whole system, whenever we see these types of changes in the sort of fundamental legal standards, that it takes some time, right, for these to be ingested sort of fully and both by our caseworkers, but also by our court partners. Obviously, Administrative Office of the Courts has worked, strongly, I think, to try to educate, especially our commissioners and judges around both, the potential harms of removal, but also the difficulty that high potency synthetic opioids represent in some of these cases. And so we actually, I think, might be able to, again, I feel like I'm just the offerer of webinars, but we do actually have another webinar coming up, and I'll make sure that Laisha and Nicholas get all of this so we can share it out. But we do have another webinar coming up where you're going to be able to hear directly from our caseworkers and supervisors about cases that involve high potency synthetic opioids. We did a series of listening sessions across the state with our caseworkers, and I was lucky enough to sit in on one of them and found it so interesting and instructive of like how complicated these cases are, how different the patterns can be, fact patterns can be between them, the struggles that I think the whole system has having in dealing with these particular cases where there is this really, deadly substance involved in them. And so we are putting together a webinar where people will be able to hear directly from our caseworkers. And so I think that will answer also some of the questions, but certainly it takes time to implement and to fully get these changes, which is, why I think as we are contemplating additional changes, I always sort of caution people because it does take us it can take 12 to 24 months really for the system to be able to understand like how to apply a new law.
Anna, I see you've got your hand up.
Yeah, as we're talking about, imminent danger and trying to figure that out, one of the things that I noticed in there that just blows my mind is drug use. So a lot of these children were returned home to parents who use drugs. How in all of this legislation and stuff, how can you address that piece? I was a CASA, but it was for our tribal program, so our court systems work a little differently, and that is one of the things. I have two daughters who've worked in ICW for years, and I always ask these questions, well, what can you do, because that, I think, is the dangerous part. And how can anybody say that, oh, the kids will be fine, mom's using, but they'll be fine, they're safe? I'm just curious, how does, what you're working on right now with that, how do you take that into effect? I couldn't really see it in any of the reports.
Thanks, Anna. I think our child welfare, first of all, the legislation surrounding removal specifically says that we cannot remove just for drug use. So we are not, other than the courts being able to consider the danger of high potency synthetic opioids, we are not to remove just for. So our caseworkers work really hard to put safety plans in place. And if you've done this work and you have family who's done this work, you know that those can sometimes they're sustainable and sometimes they're not. Safety plans may include another parent in the house who's not using, or a caregiver who is caring for the child when the parents are using, or a respite caregiver who can be used when there's relapse. It can also include other kinds of professionals in the home who may be helping out too. But those things can fall apart. Relapse is a part of drug use. Relapse is a part of recovery. And if we were to, on the other side, if we were to place all families all children who had substance use in their family, we would not have enough places for them to go. And there's not enough treatment for those who would like to get treatment. So I think, as Jenny referred to before, we don't want the only option for parents and families to be to place the child. That is an option, and if they meet standard and the court determines, that is what we'll do. But the ideal is for families to have access to, more families to have access to the services they need to prevent them from being in those circumstances. And most certainly the lack of access to substance use treatment in this state is a contributor to what we're seeing.
Other questions? I also think, Anna, family focused, oftentimes a single parent at a time, as opposed to a whole family getting the care they need, so that oftentimes you have one that's gone through treatment and comes out with someone still in active addiction, and it's a very difficult place to be. So I know legislatively, and with the Children and Behavioral Health Work Group and the work I know in the rooms I'm sitting in, it's really this conversation around what is that model. And I think oftentimes our tribal partners are doing an incredible job, especially in this space, and we have a lot to learn and a lot to do. And I know that the state is paying attention, but really we have to think about things in family systems, however those families are defined, and that's, I think, one of the most successful approaches. But yeah, so a really tough conversation. No
And
one wants
obviously
to
you
see
didn't.
kids.
Oh,
Yeah.
sorry, Senator.
No,
You
you're
didn't
fine.
see any request from us. We requested things that systems we can put in place. You did not see sort of requests that would potentially sit in other systems. And so I think, our ideal would be for us to be able to be offering a much more robust suite of supports to those parents in terms of drug treatment. Sometimes that's inpatient, sometimes that's outpatient. We have a whole host of tools that are available to us and not enough access. And so we would also sort of highlight that as we would love, again, also especially opportunities for those types of locations that allow for inpatient treatment with the child to be able to go with them. And there's just simply not enough of those types of beds in the state of Washington right now.
Shelley, you're going to round us out in this section. We cannot hear you.
You want to put your question in the chat, Shelley?
Yeah, put it in the chat and then we can make sure to answer it. All right, anything else for the good of the order? Jenny, Julie,
Looks like-
Brianne, thank you. Yes,
Does Katie have her hand raised? I just wanted to double check. Okay, I must have an error on my screen. I apologize.
Okay, that's okay. I was gonna say I see no hands. So anyway, want to thank you, the three of you, for being here and for sharing that information. And Vicky too, I forgot. I don't see Brianne, I see Vicky. So I really want to appreciate all of your time this morning and really helping us. And I think it's also great to be able to get the information ahead of time so that we really can spend our time doing a little bit of a deeper dive and asking questions. So, you know, that is helpful as well. And with that, if there's follow-up, I know that you will hear. And you'll hear probably from Elisha or whatever. But with that, I'm going to pass this over now to Dr. Levy, who is going to take us through public comment.
Thank you, Senator Wilson. Before I invite the first person to unmute and speak, I will read out our usual public comment statement. The DCYF Oversight Board operates under state law, which outlines its authorities and responsibilities. Specifically, the board is responsible for monitoring DCYF's progress towards achieving outcome measures, ensuring DCYF's compliance with applicable laws and policies, overseeing DCYF's performance and policies, offering advice and input to DCYF, the legislature, and the governor. While the board may consider information brought to its attention as part of its general oversight and monitoring role, it does not have the authority to investigate, direct, or alter DCYF's decisions in individual cases. Additionally, during public comment periods, neither the board nor the meeting presenters can respond to comments beyond a simple acknowledgement. All public comments related to DCYF will be compiled and sent to the DCYF leadership following the board meeting. To respect individuals who have sensitive stories to share or wish to discuss details of individual cases, we'd like to remind you that the board is subject to the Open Public Meetings Act. That means that our meetings are open to the public, recorded, posted on the Oversight Board website, and live streamed on TVW. We received 2 written public comments submitted in advance, which the board has already had access to and hopefully has read. Those will also be sent over to DCYF. To ensure that we hear from as many individuals as possible, we're trying to keep comments to 3 minutes or less. And I'm just going to insert in that we tried to do more people in a shorter period of time at our last public comment, and received feedback that people felt like they wanted the full 3 minutes. So now we've kind of gone back to establishing 3 minutes as your time, and then we'll just do as many as we can fit in with the 3-minute timing. So with that, we will proceed to the first person, who is Christina from Keeping Kids Safe. Go ahead and unmute and go ahead, Christina.
Hi, thank you for the opportunity to speak. I kind of forgot about the meeting today, so I'm not as prepared, but I did want to speak on the continued fatalities and the lack of that community services is not going to be enough. We need to stop saying that. As I look through the fatality reports, you can see that services were offered, services were put in, and services were refused. So if the services are refused, the CPS has to close the case, and the families don't get the help they need. On a fatality, MH, there was numerous intakes over years. There was numerous intakes from May 1, May 5, May 6, and the baby died on May 9th. There were so many opportunities to intervene and do something, but the family refused services, and so they had to close the case. For CT, the mom refused to open the door after numerous attempts. And that fatality case also had 2 years worth of interventions and services etc. And then when we talk about using 6109, well, they have to get to the point where you actually go to court and use that. A lot of these fatalities, they weren't even taken to court. As far as the imminent harm term, it's a criminal term. Social workers are not lawyers, they're not law enforcement. And so them having to prove something to a criminal term is not something that they're able to do. And as far as the kids not having places to go, that's because DCYF has driven away foster parents. The continued disrespect and regard for foster parents, and foster parents are tired of seeing babies being sent home and dying or nearly dying, and then being returned and returned. I know foster parents have had kids like this is the 5th time they're in care, and we're still talking about reunification. With foster parents with kids for years and years and then being sent home. So, and then knowing a 2-week period in October, these fatalities are going to be more. 2-week period in October, we're aware of critical incidences almost every day. There is so much more going on than is being reported and talked about. So sorry, it's a little combobbled, but again, I just wanted to get some of those issues out there. Thank you.
Thank you so much, Christina, for coming in today and providing your public comment. And once again, these comments do get sent over to DCYF. Okay, the next person on my list is Jamie Williams. There she is. Okay, Jamie, we see you.
This
Go
is
ahead.
Jamie from Fostering Change. Hello, everyone. We are actively working on a bill to amend 1227 for this upcoming session, and I'd like to take this opportunity to encourage you all to support us efforts. I also want to highlight that the driving force behind 1227 was to propose a solution for disproportionately harming children of color by means of removal. But in fact, according to the Ombuds data, critical incidents involving not just children of color, but all minority groups have significantly increased. 1227 is not protecting our minority families, it's hurting them. It's also placed an unbearable burden on our social workers with unrealistic expectations, with failed services that we cannot even fund and we can't staff. We know this wasn't intentional, but this is the reality of the situation that we are in. And we have an opportunity to make it better for all children while continuing to support families. And as Tom Dent has said, when you walk straight into a wall, you don't keep walking straight. You have to pivot and we have to make a turn. I also appreciate Anna's comment about sending children back home to environments with drugs. I can personally give testimony to that as a labor and delivery nurse who was there when the ambulance brought in a 3-pound baby who was born in a toilet, who was seizing so bad that we had to life flight them out of there. I just cannot stomach the fact that we would send that baby back home to the same environment. It's inhuman, it's immoral. We are not fulfilling our moral responsibility to protect children in Washington. And I also want to make one more point. When we talk about children exiting and entering foster care, we are not tracking that for the shelter care period. We are the only state that does not track that. And so when we talk about this harm of removal and trying to, protect children from having to experience that, we have no idea how many times we are putting children in and out of foster care and foster homes in that shelter care period. And we absolutely need to track that. And I am just going to end today with extending my appreciation to the Oversight Committee and giving us this 3 minutes. We only get 3 minutes of your time. I know our emails often fall, in the vast emails that are in your inbox and often go unread. And I just want to extend our appreciation for that and giving us this time to amplify our voices. I know these are hard conversations to have, but we're going to continue to be direct and upfront with our messaging. And we do hope that you will support us in the amendment of 1227. Thank you.
Diane, you're muted.
Oh, you missed my thank you, Jamie, for providing your public comment. We appreciate you coming in today. We have one more person on our list, and that is Shauna Lowry. And I understand that Shauna is there with you, Nicholas. Oh, yeah, now I see her. Go ahead, Shauna.
Hi, my name's Shauna Lowry. I'm a member of the Washington Federation of State Employees, and I work as a social service specialist for DCYF. There are many crises in our agency right now, and one of the biggest issues is workload, and we've heard a lot about that today as well. New legislation, Supreme Court rulings, settlement agreements, and other unfunded mandates have intensified the workload crisis for staff. This drastically impacts how we can support the families we serve and our ability in working to keep children and youth safe. These unfunded mandates have resulted in an ever-increasing list of demands and expectations with no additional full-time employees to meet these expectations. Instead, legislators felt it best to actually cut funding for 7 positions this past legislative session. Right now, my region in Spokane has 23 vacancies, 96 CPS cases that are overdue, and 50 plus workers have over 15 cases. We could go on and on with all 6 of the regions who are all in similar straits. We're often threatened with discipline when we can't meet these unattainable expectations, so we understandably have increasingly high turnover. Staff who work off the clock due to fear of disciplinary action, not to mention the issues we face, such as increasing assaults, a lack of support from our agency, the failure of the state to honor bargaining agreements for the pay increases for support staff, and mental health struggles for all the field staff whose hands are tied by current laws, which have resulted in the death or near death of children due to HB 1227. We need your help. We need support. We are drowning. Reviews of child near fatalities and fatalities have consistently pointed to unsafe workloads and the Keeping Families Together Act as major reasons for these tragedies. They've also constantly raised concerns about the mental health of our frontline staff who are drowning under the weight of these critical incidences and crushing workloads. We cannot keep doing more with less. We are not the only ones who are suffering. We want to help the families we are working with, and we want to keep kids and youth safe and support families. Washington needs to prioritize the safety of children and support the staff who are sacrificing so much of themselves to attempt to meet these expectations. If you want to know how, ask. We're doing this work, and we have a proven track record of being right long before our leadership catches up. We are so tired of being the ones blamed by the media when we are only abiding by the laws which have tied our hands. We are tired of the inequities within the department regarding assignment pay. And I'm tired of workers asking me as a steward, coming into my cubicle, calling me, crying because they're so overwhelmed. We cannot keep doing this. I am continually seeing staff leaving who have been with the department for a really long time. This just continues to be in my heart. And as a youth who was in foster care, I absolutely understand the challenges and appreciate your support. And thanks for your time today.
Thank you so much, Shauna, for coming in today in person to present that public comment. We really appreciate it. Well, I'm looking at the clock. I think I'm, Nicholas, no more public comments, right?
That is correct.
Okay, so I would suggest we take 15 minutes, which would, how's that sound for folks? And that'll bring us back at, I'm in the East Coast, so I have to drop a few, 11, what is that, 11, like 11:35, something like that. How's that sound? Is that 15? 11:37.
I think it would be 10:35.
Oh, sorry. See, I'm on the East
That's
Coast.
okay.
I can't do the simple addition on the fly.
I just don't want people to go for a walk or something. So take
Yeah,
a walk
really.
to the kitchen table, but don't take a walk around the block. You may not get back in time. So
All right, so around 10:37.
let's go to it.
Welcome back, everyone. It looks like we are just past 10:37. I hope everyone had a good break. It was nice having 15 minutes. I thought it would be helpful if we just jumped right into our next agenda item, really focused on updates and next steps from last month's Oversight Board retreat. And no rush, but Nicholas, when you have a moment, if you could pull up the slides, that would be fantastic. Thank you. And maybe if it's perfect, that's perfect. Thank you so much. So I think it's important to highlight some bright spots from the retreat. A lot of work was accomplished, but it's nice to quantify it as well. We had 2 documents unanimously approved by the board. One was the DCYF Oversight Board 2.0 proposal, and the second was the 2025 annual report. Also, we discussed top priorities at the retreat. The board indicated their top priorities for 2026 using paper tally marks, and the 2 highest rated areas were 1, building a data-informed, accountable, and innovative culture. One way we might do that is by working with DCYF on their online data dashboards and making them more accessible to the public. And work like that might entail starting by assessing what existing data are there. What do we have? What do they already have? A second area that was a top priority, and these 2 were evenly matched in terms of votes, is DCYF workforce training and well-being. This work could entail reviewing retention trends, frontline staff challenges, and the effectiveness of well-being supports and initiatives. Another piece would be, could be examining the existing training continuum and delivery, the valuations and outcomes of the training, and how it relates and adapts to changing legislative and legal landscapes in 3 areas: early learning, child welfare, and juvenile rehabilitation. Next slide, please. Great, thank you. So I wanted to give folks some updates and talk about some next steps. And I want to share what's going on above and beyond the 2.0 work. And so something that we've been working on since we met on October 29th is staff has collected ideas for potential new names for the board. Another activity that folks have been involved with is drafting proposed statute revisions. In terms of work that is currently on our plate, we are working to complete the 2025 annual report. We've received some feedback from the Office of Financial Management, as well as some from the policy team. And so these are relatively minor revisions that we're working to incorporate. The goal is to send the annual report to the legislature and to post it on our website on December 1st. And then something that came from the retreat was a request to Secretary Sen for meet and greets, small group meet and greets, similar to what she just has been doing with her own staff. So this is work that is on the table for us, is to coordinate small group meet and greets between Secretary Sen and members of the board. Next slide, please. Thank you. Okay, so let's give you an update about Oversight Board 2.0 work. So there have been 3 meetings with a proposal group, and that's one meeting every week since we last met. So there's quite a bit of momentum there, and I want to just call out the volunteers who are participating in this group, and that's Bobby Bridge, Dr. Ben DeHaan, Dr. Marion Harris, and Ruth Kagi. Thank you to all 4 of you for your active involvement. One of the things that this group has accomplished is drafting an issue statement, and I think it's nice to get a little more specificity, and so I'm just going to read it here. And again, please keep in mind this is a draft. The DCYF Oversight Board has developed a new strategy for monitoring agency performance to better align with state law and public expectations for agency accountability. This will shift us away from an annual report with DCYF provided data to a collaboratively developed biennial progress report with a focused set of metrics. Metrics will reflect top priorities of the agency, the Oversight Board, and the public. The first report will focus on one of the 2 priority areas that I already mentioned. So the first one would be making key performance metrics more accessible to the public. And the second would be gathering actionable data on frontline case carrying staff. Next slide, please. Next steps for 2.0 work. The revisions that we discussed at the October board retreat will be made into the proposal. The proposal group is working on just starting to clarify and refine the outcomes. We have these very large priority areas, and we want to co-identify outcomes, but before we come to the table, we want to do some initial thinking about that. Another activity is developing proposal components for a potential funder. We are in the process of scheduling a meeting with Secretary Sen and members of her leadership team, which will occur the first week of December. And then another activity I see waiting for us in December is recruiting volunteers for the annual biennial progress report work group. And next slide, please. Wonderful. So I really just want to open this up to discussion and questions and invite any folks from the proposal group, if they have any additions. I also have a couple questions that I jotted down, but I just want to open it up in general before I turn to some of my questions. I'm not seeing any hands. So things that I am interested in hearing about are based on what I've described. What excites you most about updates or next steps that I highlighted? Are there any emerging trends or external factors that we should consider as we're moving this 2.0 work forward? And then something that I frequently reflect on is challenges and barriers or potential unintended consequences that we might encounter in starting this work. Does anyone have any thoughts about one of those or a few of those?
I'm curious myself, Lisha, how perhaps our current state budget situation and our federal, not only our budget situation, but the challenges that are coming from our federal administration might impact not, I guess, the board's ability nor an outside individual's ability, but DCYF's ability to be responsive and timely in things. If we continue to see challenges coming, especially during session and stuff. Just curious about moving forward and whether there will be a feeling as if this is once again one more thing to do that doesn't move them closer to serving kids and families. Just a wonder.
Yeah, I very much appreciate that question because it's something that I've been thinking a lot about, and I know the proposal group has been as well. When you look at the components of the 2.0 proposal, only one is really the federal funding should not influence our work, but as you know, it affects DCYF work, right? And their capacity, reshuffling their staff to address these changes that have happened and will be continuing to happen. But again, going back to those components, the first one, there's 4, was restructuring the annual report. That will be legislative work. The second is collaborating with DCYF to identify co-identified priorities. And we've done the proposal, that portion was written in collaboration with them. So we're in great shape on that front. The third is creating pathways for discussion and analysis. That's something that could be impacted because, these cuts affect staff time, staff resources. So availability I could see that being affected. And then the fourth area, which is pursuing philanthropic support for work with Office of Innovation, Alignment, and Accountability. I think that's more dependent on philanthropy, I think, who would pick up the tab for this type of work if that proposal gets approved. Great question. Thank you.
Yeah, no, always trying to keep in mind what that means, and especially during, period of time and what period we're looking at versus we're in a longer term period versus not having to operate, for example, in a 60-day period. We're looking over the long term as we're thinking about, our work together. And I think that's important too. So appreciate that. Thanks.
Thank you. Any other thoughts about things we might encounter, barriers, challenges, things that should be on our radar? Okay.
I have one thought about a potential challenge that I think that there's still this sort of push-pull kind of DCYF Oversight Board and DCYF relationship that we're making some strides with that, but I still see that as a potential challenge in that we have a statute that we're trying to amend. We're going to talk about that next, but at the same time, that puts us in a position of asking for some accountability from the agency. And I think there is still the sense, I think, to some extent that we are not that value add, as Ruth is prone to say, but we really are more of kind of the thorn in their side sometimes. So I think there's just a kind of an inherent part of our relationship that I think it can be challenging and that we just have to continue to reflect on and find ways to kind of move past so that we can be effective partners, but also do our job and be independent and to some extent.
Yeah, I completely agree with you. And I think, independence, as we've discussed before, is absolutely critical. And one pathway that I'm seeing through some of this push-pull is prioritization, right? We can't send them 100 questions. We have to really kind of see what rises to the top and really provide a rationale for why these questions are most important to the board and our community members and other partners. So that's something that I'm thinking about, and I'm hoping I think the goal of everyone who worked on 2.0, and this was a massive group, is that this will be a real strategy for allowing us to have more effective relationships that really kind of honor capacity and time and resources. So that's something I'm hoping we get to. But I think that push-pull will be there to some extent. Yeah.
I was just thinking too, we heard their DPs, their packages, decision packages and their agency request legislation, and their top one, right, was child welfare, which included caseloads, right, and work. What's our top issue for our priority? And that is worker well-being. You cannot disconnect those two. So I'm just saying that because I don't walk in believing we do have a disconnect in our relationship. I think we have to find where we have a connection, where they see the work we're doing in support of, if you will, even though we may come with more demand or more wonder, it still is moving us forward in a direction that they are also interested in moving forward on. So I think that's also, as we focus in, going to be really helpful in kind of what we're looking for, what we're looking at, what we're asking for, because I don't think we've, and I haven't been around that long, but whether we've had that kind of a needle focus in some particular areas. And so I was just thinking today, as they reported out, that is a sweet spot where we also agree. And, Danielle, because it's not just about the number of staff and supervisors, it's also about all the other climate and culture and all those pieces. So clearly a model of who's doing it and how many people and what your caseload is. And we also care about the health and the well-being, which is also part of that picture. So I look forward in trying to figure out how we we look for those sweet spots where we come together, and then it's a better space to then think about where we don't agree and how we build a greater understanding. So really appreciate the conversation.
Awesome. I agree. And so much of your perspective is really invaluable. So if there aren't any more questions, and it looks like we did have a pause, I can take us to our next section, which is kind of a bylaw refresher on board rules. And if you could please pull up those slides, Nicholas, that would be amazing. Okay, thank you. I'm also getting my own notes ready. Okay, great. So we're switching gears. This is a shorter, even shorter presentation, and it's really focused on, and if we could go into presentation mode, I know sometimes it takes a couple seconds.
Yeah, sorry, I'm having a lag. It's getting there.
Oh yeah, no worries. Technology. but I can still set us up. So I touched on this topic of roles of board members briefly at our meeting in October, and I wanted to share 2 example scenarios to help kind of clarify this topic. Broadly, the co-chairs serve as the official spokespeople for the DCYF Oversight Board. So guidelines like if a board member is approached by a member of the media for a statement on behalf of the board, please direct them to me so I can coordinate any response with the co-chairs. Another example is if you're interviewed by the media, you're welcome to say you serve on the oversight board. We want you to say that. However, please avoid presenting your comments as an official position of the board. That is something that wouldn't be within your purview. And then it's important to remember to be really clear about the role in which you're speaking. For example, are you a representative of an organization, or are you speaking as an expert in your field or as a community member? And then I always like to go back to the actual bylaws. And this is from the bylaws. I'll read this. The co-chairs will act as the board's formal spokespeople. If an alternative spokesperson is needed, the co-chairs will designate a board member to serve as a spokesperson for specific issues as needed. So are there any questions about that? No question is a bad question. I have the scenarios ready to go, but I just wanted to pause for a moment. Okay,
I have a
Nicholas,
quick question.
I see Anna's got her
Sorry.
hand up. Yeah.
Yeah, I had my real
Great.
hand up. Are we public? Can someone search to see who is on the oversight board? So they could,
Absolutely.
if somebody wanted to do their homework, they could seek us out.
Oh,
Okay,
absolutely.
okay. I was just thinking because when you were saying if someone approaches you, I'm like, why would somebody approach me? But I totally understand. Thank you.
Yeah, I think that's a great question of clarification. So on our website, we have one member that it still needs to go up, but you'll see all 18 faces of the board members in a brief bio. So yes, we want to like increase transparency, people to know who's participating in this. And so yeah, that's a great follow-up question. So Nicholas, if you could please go to scenario A, that would be awesome. Thank you so much. Okay, I'm just going to read this. Someone from organization X reached out asking to meet about their concerns regarding HB 1227. Since it wasn't related to an individual case, the person who sent this to me said, I'm inclined to follow up. Is this within the scope of my role as a board member? So I'm interested in people's thoughts about the question or what you might do. Rep. Dent.
Thank you. So from my position as also a state representative, it is within my purview to respond to that and engage them. It's not my role to say how I think maybe the entire oversight board might feel about it, but that I am inclined to follow up with anything like that.
We're in 100% agreement. I couldn't agree more. It's your role, in your job, or for other folks who aren't legislators as private citizens and experts. And exactly what you said, please just don't speak on behalf of the board. And if you're unsure, just shoot me a quick email. That's no problem. I've had a couple of those this week, and I always welcome them and appreciate people, really thinking intentionally about it. So thank you. Any other thoughts before we go to the second scenario or questions? Okay, Nicholas, if you could please show the second scenario. Thank you so much. Okay. A professional organization contacted me with concerns about overcrowding at Green Hill School, and I met with their executive director. I was also planning to connect with DCYF directly since the issue relates to past board discussions. This isn't directly part of my board role or existing work I have with them. It's more connected to my professional work. Would this be overstepping? Okay, thoughts, questions of clarification? And this is something that where I'm still thinking about these nuances. These scenarios have quite a few nuances, so it's not always black and white, right? Shelley.
Well, I don't know if I'm right on this, but I'll just tell you what comes to my mind. We do work with Green Hill on occasion, and could happen that this exact situation comes up where we're working there and some other community member comes to me and says, hey, what's up with this? And I could respond to them on behalf of the work that we are doing in there, but I could not represent DCY. In fact, I may not agree with some of the decisions the board make. So I would only represent my agency and the work that we have going on at Green Hill.
That's my perspective as well, right? Like you have an existing body of work with DCYF specific to Green Hill School that's completely separate of the oversight board. That makes perfect sense to me. Anna, I see your hand is up.
Yeah, I was just thinking, you know, a lot of this work is new to me and I don't have experience in it, but I do, my professional career does carry me into those rooms sometimes. Again, it would be, I can seek more information for my own, just so that I can do a better job representing on the board, but I would not want to try to speak on behalf of the board, correct?
Absolutely. Absolutely. Thank you for that question of clarification. Bobby.
There's another little nuance in this one, however, which I assume you wanted us to pick up about us talking and saying, you know, listening to the person, maybe even given our own personal opinions. But if we do, we know we make sure we articulate that we are not speaking on behalf of the board. But the other nuance is then I'm planning, it says, to connect with DCYF directly. To see this, because these issues is related to some past board discussions. Well, we discuss many things here, as is indicated by this morning's Q&A, and that could be about 100 different things. It seems to me that there's a step there that either involves you or leadership, meaning the two co-chairs, who should be consulted before the board member takes it on him or herself to go to DCYF. Even if they're saying, I'm not contacting you because of the board, I think that doesn't do it at that level.
Absolutely. That's something that I wanted to call out, and I appreciate you catching that. So there could be work going on related to your question that the board is doing that you might not be aware of. And so I think bringing me in makes so much sense. So that way I can coordinate efforts and I don't duplicate requests. We don't want to send, 30 different emails all about the same topic. And so really going through me, I can help coordinate, loop you in, and make sure that we're, elevating what it kind of fits within the priority of the board. But I really do want to be a point person for folks as someone in probably the highest contact with DCYF.
Well, and that is as it should be, given your roles and responsibilities of your position.
Yes, it's a privilege. Yes, thank you, Bobby. Great point. Diane.
So I have a question too about advocacy. We are coming into another legislative session, and this is for maybe non-legislators in the group. We potentially could be advocates for the decision package that DCYF is putting forward, or similar legislation. How do you feel about people on the board being advocates for specific pieces of legislation?
I think that's a great question. It's something that I've thought about not so much, but I think that's great. I think, we are committed to DCYF's success and allowing them, the tools and the resources to get there. And so I would support anyone's advocacy. I don't know if there are more nuances. Rep Dent?
Yeah, I mean, I understand how we may support legislation or not. I think if we're going to support legislation as an oversight board, then we need to be in agreement, and we should take a vote to do that. I think that's important to understand. But I think it's all of our rights as citizens. If there's a piece of legislation we're passionate about, by all means support it. Maybe Senator Wilson and I, we might disagree on legislation. We sometimes agree on legislation, but it's our constitutional right to do that. And so I think we need to be careful that we don't drag other members of this body into a piece of legislation that, they either don't understand or can't support.
Well said. Thank you.
Agreed. I think that is very, very important. And I think, as we heard on public comment, a piece of legislation potentially coming before the group looking for support. And that would be, for me, a difficult thing to do without actually looking at it, knowing what else was happening on the legislative front, which we won't know until December, until the hopper opens up. And so it is really important, I think, that we are a neutral body, if you will, and on behalf of kids and families moving things forward. And if folks have passion and purpose, they can always speak to that as an individual. But we, yes, would, I think, one as a full body or a group to say if we are in fact supporting something, that we are supporting it as a board, and that would be a decision we would all make together. So Rep. Den, I'm in total agreement.
And I just want to call out a beautiful example of that. The board did a statement on racial justice and equity a couple years ago prior to my tenure, and that was something that the entire board agreed that was something that was important to put forward, and that's one example of coming together to have a platform. Okay, any other thoughts? These situations aren't, like I said, they're not black and white, and so I do appreciate the rich discussion.
Oh, just one more thing before you go. Yes. I think that what we're saying is the same thing, but they're just, the bottom line is that there needs to be clarity of our purpose, and our authority, meaning that we may be advocating on behalf of something, for something, but it is not necessary, but it is not a part of the board unless we have decided it is a board.
Yeah, beautiful summarization. Thank you so much, Bobby. Awesome, thank you. Okay, so now I'm going to turn it over to Senator Wilson, who will be talking about some proposed statute changes.
All right, here we go. I think there are two documents that will be helpful to kind of perhaps that I'm going to be speaking off of. And one of them is the actual legislation that I think came to you, and it has color coding on it, yellow, green, and turquoise. And then the other document that we'll be sharing the screen, and thank you, Nicholas, for being the IT guy, because it's helpful for me, is the actual chart that might be the easiest thing to look at, which is the changes that are in this current 18-page document. I think I want to, or 18, I think it's 12 pages. I'm going to exaggerate here. I think the first thing I want to do is kind of orient you to what we did, so that it's a place to start. And, that is when you actually looked at the current statute, the Oversight Board and the people on it wasn't actually even called up or out until I think page 10 of the legislation. And that was because it was a creation of the entire agency, and a piece of that then was having the Office of Children and Family Ombuds be the group that called together this oversight board. So in the creation of things, the board itself, the language for that shows up in the back of the statute. So what we did was we took the back of the statute, which talks about the board, and moved it to the front, and also added an intent section. So section 1 of the new document, and Thanks, Nicholas. If you want to pull up just page 1 of the chart, and if y'all have big eyes or small eyes, here we go. So 8A, so the section on the left is the old legislation. The section in the middle is the changes that are made, and you'll see in the current version. And then on the right is the actual notations of kind of what you might be looking for in the change. So the example is number 1, section A, or section 1, as I said, is an intent section that did not exist before. And the intent section, the idea was that if in fact, I'm going to step ahead and then go back, if in fact we were going to change the name of who we were as a board, it was important to have, I think, up front, still the concept of what the board's job was, what their role was, and in their function. And so we added the section 1, and also in that, put in a new name that is a temporary draft new name, and we'll have that conversation later on. And in this document, we are calling it the Department of Children, Youth, and Families Policy and Accountability Board. And the reason that's in there is at the time, that was the feedback I had gotten, but since then, we have some other suggestions from the board. So I want to go back later on, and we'll talk about that. Section 2, if you go, so the only things that you'll see here is that it has been reworded, and that it clarifies now that the board no longer lives inside of OFCO, the Office of Children and Family Ombuds, which is where it started in its creation. But currently, Elisha and Nicholas sit under the Office of Financial Management. So the language says that that has been the change. And it's for administrative purposes only. It changes nothing as far as kind of what they're doing. It just is kind of where they're sitting. Does that make sense? And someone else is going to need to keep their eyes on hands. I'll just say that, Lisha and Diane, if you could help me out with that. So the new section 2 are the old pages in the back of the statute, pages 10 to 14. You'll see a whole section, those things struck out. They are not missing. Some of them have been removed, but a lot of that information was moved again to the front. And that is the section 2. So section 2, if you look at it, is the membership. And we moved it up to the front. And also we added in the membership of this board, the secretary of the department or their designee. For they were not part of the board, and a non-voting member, but there was no designee from a leadership level to represent the board, to represent the agency, to even be there to respond from a leadership level. And so we did add that as well. Questions on that? Am I good?
I don't see any hands up.
Okay, I'm walking through it. The
Wait,
next
I
one
spoke
is
too early. We've got Rep Dent there.
Oh, okay, Rep Dent.
Thank you. So, there is one thing we do have, and I'm not sure it should be in here or not. I don't read it, but, we have a provision that at least 5 members of this board reside east of the crest of the Cascade Mountains.
Right. And don't we have that in language, Lisha? And I think it is, but I'm going to have to look. Oh, it is on page 3, Rep Dent. It is C. So 2C. The remaining board members shall be nominated by the governor subject to the approval. When nominating, the governor and appointed must ensure that at least 5 board members reside east of the crest of the Cascade Mountains.
Okay, perfect.
Yep.
Thank you.
Thank you. Important. Okay, the next section is section 9B, and it's only a number change. Nothing in the body of the document changes. And then we move on to the section that talks about the duties and the powers, and that's on page 4 of your document. And in this section, the word oversight was removed, and wordsmith. So you'll see on you won't see that word in there. Number G, or letter G, was struck from page 12, and that is about the licensing section. And then letter H was amended and added the word, or amended to remove the word annual. And we were conducting reviews of the sample department contracts, but not annual reviews. So those were changes that were made in the duties and powers of the board. And we move on to number 11. Again, we struck the pieces that were in the back of the document that had to do with the decisions that we made in 2.0. I'm totally confusing people or not. Rep. Dent.
Yeah, thank you, Senator. So I'm not sure why we're changing 10G, why we struck some of that. And then on 11 here, where we struck something, the language is moved. You know, we should put this together as in the form of a bill, so we just line out what we're going to strike so we can see what it is. Because
Well, and it is lined for you in the full document. So you have that, a copy of that as well, if that's a better way for you to look at it. And that is the one that has the lined as well as the color coded, so one could see what was specific to the board, what was specific to changes for DCYF, and what was specific related to the revision of the actual document, the changes in dates and the removal of dates and things. Do you have that? Is that some people like charts, some people like the documents. So if it's better, I can go through the actual line document. Is that an easier thing to do?
Well, I think it's easier, but I think this is a major change that I think is going to affect a lot of people and be a lot of opinions on this. Folks that worked on this in the beginning. So, yeah, I have it here, but
okay. And again, when you see the items lined that are lined out from page 10 to page 14, not those things, many of them are still there. They are just moved to the front and renumbered. Some of the things that were the actual procedural things that were not really statutory, but were the reporting things, were the actual conversations we had and have had, I believe, as a board and in our adoption of the 2.0 proposal, was changing the idea that we were going to have, we were going to select with, in partnership with DCYF, the 2 areas of focus, and also we would as a board continue to choose areas of focus as well. So let's keep moving forward, and then if
Claire,
folks don't, yeah.
Can I just insert that?
Please help. Yeah.
Well, no, that I think the reality is this is the first time you all have seen this. This is just basically we're looking for feedback. So this is an important time. If you have concerns about pieces of this, that this is going to be or if you want to think for it a while and then give people feedback selection or feedback, I think this is a critical time to think about it. So this is not a done deal. In other words, we're in process here. Is that fair, Claire?
Yes, it's draft, and I hope I said that from the very beginning. And again, these changes were based on board feedback that we had been working on together, and then also changes just anytime you update legislation. And also the whole conversation around the reiteration or 2.0 and what does that look like for the board? And also the fact that it no longer does sit under OFCO, and with our reiteration and with the new executive director, it just made sense that we do this. But clearly, we're in a draft mode for recommendations, because even after we recommend, it still goes through the legislative process. So I'll also just, say that. And it looks like there may be lots and lots of changes, but I don't believe they're as substantial perhaps as it may look with all the lined language and the line changes. So anyway, so I think on where are we? On if we look at where Nicholas is, again, we adjusted language in number 11 and we moved it to what is now the new 3A. And I'm going to pull it up. We also made some changes and simplified the language related to our convenings. And one of the things we had talked about was in past iterations, it talked about we had to meet twice a year, we had to convene groups, and we've talked as a board how we also have other ways of collecting and gaining information. So the language that you see there is a simplified language and hopefully reflects the board's ability and says they can meet with individuals, with groups, with community reps, with organizations engaged with or affected by departments, programs, and services, and just simplified the language and didn't give a number of times, just made that change. If we move forward to number 13, the next page, it was another one of the things that activities that was listed in the many things that DCYF Oversight Board staff was supposed to do. So that number 13 was struck altogether, and that was around reviewing existing surveys of providers, customers, parent groups. And I think much of what we do is already wrapped into kind of what our other focus areas are. So 14, 15, and 16 are the same. They just changed the section number to the beginning. Again, instead of the end of the document, at the beginning of the document, 5, 6, and 7. So nothing substantial there. Nicholas, can you go to the next page? Awesome. Again, 17 and 18 are section changes only. The next change that's substantial, if you will, is number 19, related to the annual report. And again, in our conversations and in our work with DCYF and with leadership around how we move forward, it changes the report to a biannual report instead of an annual report. It requires the report to be due by December 1 of every odd year, which, is that correct, Lisha? Your head just tilted sideways.
Yeah,
Are we
so
that we
I think
didn't catch it, or is it just?
no, we didn't catch it. Yeah, I
It's
believe it was
July.
July 1 at the
Yeah,
end of the
July
fiscal
1. I
year.
looked at that. I'm like,
Start of the
wait a
fiscal year.
second. So the report's going to be due by July 1 of every odd year. We need to make sure to make that change. I'll let Zach know. And then it also gives the board the ability to select and change performance criteria. So again, looking at our work and how we'd like to change and focus in on particular areas, it gives us a chance to kind of do that. Any questions on the annual report piece? And again, you'll see the dates are removed, the years of the dates are removed because that's kind of cleaning up the language of the statute. But duly noted that on the column on the right, it should say July 1 every odd year. All right, so keep on going. The second section, no change in the number 1. Again, the next few, there's no changes. They had to do, staff always are asked to go through by the code revisers and clean up, make technical changes and then clean up dates. So that's what you see on those. But again, the things are still, language is still the same. You just see the dates removed. And if we go to the next page, again, technical changes, codes cleans up. And sections 8 through 19 on the very bottom, that is the back number of pages that are turquoise with all the strike throughs, and those were moved to the section up front. And that speaks to who's on the board, the terms, and it talks about it also talks about lived experience and things like that, in that I'm trying to, my words are not coming out, but it's all about the board itself is now all up front, and the other things that were removed you'll see. So is there another page? Okay, so and again, the last change is the definitions. And that is that we removed direct lived experience because it's now in statute and the definition is aligned, so we don't need to call it up and out on this one. And this particular one also updated the new name, which would change if the board decides that that this name doesn't cover it, and they would agree with a change on the board's name. So if that makes sense. Anyway, so those are, you know, the major changes, and really significant is I think the addition of the secretary or a designee to the board, as well as the removal of what we heard from the group who originally were part of the creation of the statute. A lot of the metrics and measures and performance measures that Lisha and Nicholas were reporting on are things that are already reported on, or things that have already go to the parties that see them, and trying to figure out a way where we really hone in and help in a way to support the work that's happening from DCYF. And that's from both a partnership, but also accountability and a monitoring perspective. So, you know, holding folks accountable is an important thing and a role we play as well. Questions, or Elisha and Diane, anything that is like, oh my gosh, she totally, you know, it's a tough thing, you know, to look through everything, and hope I hit the big points on this
You absolutely
piece.
did. In from what I was hearing, I just had one question, point of clarification near the
Yes.
end. You said this at the beginning, but just so everyone is on the same page, with respect to the addition of the secretary or their designee, they
Yeah.
would not be a voting member. It would be a non-voting member, which you did say at the beginning.
Yeah, no, and then that is reflected in the chart, but that is an important thing. They are there really as ears, and I'm going to be really honest, we do have, you know, someone who works in and for the agency, but it's a very difficult thing to have letters by your name and not either want to, I would say, or have a role of representing when you have not that power, if you will. So it's really important to me, if our work is with the department, that we have folks that can hear us and also have the ability to make the changes at that leadership level that sometimes need to be made when we look at programs, outcomes, and things like that. So yeah, appreciate that as well.
Can I step in and ask, do people have feedback on that? My question when this was broached was whether or not that would make folks feel a little bit more reluctant to be honest in this kind of board meeting if they knew that, say, the secretary was always going to be present. But maybe that's, I mean, what we'd like to do is have more communication, so maybe that helps. What are people's senses on that?
Well, this was discussed when we did this way back, and it was decided that we did not want them there. We're the oversight board, and we did not want. There may be sensitive issues to discuss. There may be things that we don't want to get into a discussion or an argument with someone who was we're actually looking after, holding accountable. So I'm not pleased with that. I'm not. There's a lot of things in here that kind of came after that I'm concerned with. This document needs to go to staff and be analyzed and compared. It's a little confusing the way it's laid out here. So and have input back from them so we know exactly what we're doing, exactly what we're trying to change, and so we know the consequences of the changes we're making. I think it's very important. This board was a major part of this DCYF becoming into existence. And without this, it would not have passed the legislature. There were not votes to pass it, to create DCYF. So I think it's very important that we take this, the makeup of the oversight board very seriously and not be making changes that may not be part of where we intended it to go in the first place. And as the lead for my caucus on creating the DCYF, I can attest to the challenges that were laid on us when we went through this part of the oversight committee. So I think it's something that I'm really passionate about, to keep it solid, to keep it whole, and to make sure that it does the original intention of what we put it in there for.
Thank you very much. And as the person who negotiated with you, Representative Dent, I think it might be a good idea for the two of us to go through these changes together. I really support many of the changes because I think they fit the capacity of the board better. But I'd love to talk to you more at length about it.
I'd love that too. So is it going to be at 6 o'clock in the morning when you come in my office with a cup of coffee, or?
Like the old days.
I got to tell this whole board something. There was nothing I've enjoyed more since being in the legislature than negotiating this with Representative Kagi, and the conversations we had, both good and bad. It was one of the proudest things I've been a part of.
Well, we will revisit that.
And I would also say it's important to remember it's our board. And so the secretary, if we're inviting, is a member of that board as a non-voting member. And I would believe it would be the co-chair's responsibility to make sure that it didn't become a place or a space where the secretary would take on the board or take over the board, that they are there as more ears and more really listening and perhaps providing information, but not defending, if you will, the conversations of the board. That would be my hope as someone sitting there, because I think sometimes hearing things through people is different than hearing things from people. And I would not expect that we would get in. I just think it's if I recall, in the past boards, it's been important and the board has wanted representation there from that leadership perspective. So also trying to figure out how you find that balance of asking them to be in the room so that they see it's an important group to meet with, but at the same time not taking over a conversation or having it move to something that's a benefit for the department more than it is for the original intent of the board. So, look forward to that ongoing conversation, because, it's a critical time right now. It's a perfect time to be having this, I think. So other wonders, other questions around this? The legislative session begins January 11th. The hopper, if you will, which is where bills kind of get put through and go to the code revisers, opens on December 1st. And so one of the next steps would be making sure people were able to provide their input and ideas. And then so that we can have whatever document is coming from the board, whatever suggestions they have on the on the draft legislation. And the document, I will be honest with you on, that you're looking at is comes from me and comes from the Senate Democratic Caucus and my staff that's working on this with me, because it would go through Human Services. So clearly it's an initial draft that to work from. But this is how it shows up in statute, and the changes are based on just in our conversations with Lisha and with Diane and with the group, kind of what might make sense is the next iteration. Bobby, you're muted.
Recognizing the time constraints, we do have a December meeting, which is on the 17th, as I recall. It's a Wednesday. And it does seem like there's work to be done, at least homework on members, because on the other hand, it is going to be this board's piece of legislation, right? And so we need to feel comfortable with it. And it seems like we need to take the time between now and then to sort of do whatever processes we need to do, like the Kagi Dent coalition here, and others who kind of need to think through this as well. And so what we need is a process that can get this study and exchange and decision done in a timely manner, and whether and be prepared at least by December 17th to take a vote.
And it would be a vote on the document, which then still would go through a legislative process. So yes,
Yeah,
and
right.
It's a short section, 60 days. And the sooner we can get it in, and clearly the board wants to buy in on it, because they are it. My hope would be people would actually do that, and we would be ready perhaps to actually decide whether the board recommends the version that we have to have a chance to get your
By the
feedback, but
17th.
also to incorporate the feedback so you can see what it looks like and all that. And yeah, so we've got to figure that out, because it's staff time too for us.
Well, yeah, some of us don't have staff anymore, but
It's policy staff. It's more than it is.
So say that we would at least have this done by the 17th then, and make a decision on the 17th.
Yeah. Yeah, and my hope would be we would have a copy of whatever it was, so that people would look at it before the 17th, and we would come on the 17th ready to determine whether or not, and if not, we would know if people were not happy with the current version.
Yeah, I agree.
Yeah.
Exactly what I'd hoped would happen.
Yeah. Okay. And perhaps we can put some dates around it, Lisha, and send something out so that there's an actual track, if you will, of the email, and here's the documents, and folks can give us their feedback on that. That'd be great.
Yeah, I think there needs to be some sort of organized pathway, like you're suggesting. That's excellent.
Yeah. It's always easier though when you have something to start with, and that's what this is something to start with. So that's that, and then I'm going to move to part two, and part two is around the name. And there's a couple things that I wanted to share, and I know that Marion was unable to be here today, but at the retreat last month, I think that's when it was, she brought up her interest, and I will say others' interests as well. She's not alone in the concept and the idea of changing the name of the board from DCYF Oversight Board. And part of that comes very much from an equity perspective and the idea that there are unintended effects on communities of color. And it's also, I think, really important to note that in addition, it may not, or it may, but it may not be the best name, if you will, that really accurately reflects, the functions of the board if we actually go back and look at that. The other thing I want to say is it's not unusual or uncommon at all to think about verbiage and to think about how things have changed along the way related to our statutes and related to legislation, especially as we think about our state's focus on equity. And I'll use my example in corrections. Oftentimes, in every piece of legislation that I do, you'll see the word inmate because legislation hasn't been changed for years. And that every piece of legislation that has that word is changed to incarcerated individual where it makes sense to do that. And so it is not uncommon to do that. I think the other thing that I would share is that as this body and this piece of legislation goes through caucuses, and I know in my own caucus, that the members of Color Caucus, as well as the other affinity groups, always review legislation. And that word oversight would be a red flag to them as well. So I just know that in every piece of legislation we review and we update our language to make sure that it's inclusive and has an equity lens. So why the reason and why it was brought forward to potentially think about changing the name. And there are a number of suggestions, and I think that's the next slide, if you will, that came forward from our members. And when we look at kind of what the words mean, accountability board, as clear, concise, it highlights the function without implying authority. Monitoring board, a policy and accountability board, or accountability and advisory, which some believe better reflects the board's authority and dual role of both accountability, but also guidance. And I think our conversation around how do we help DCYF see the expertise that's in this room to help them when they need that and when they want to have some differing opinions and expertise. So, the question is where and how do people feel? Where do you sit? What sits best for you if we were putting a name change forward? Because I think it is, again, if we're going to do legislation, it is the opportune time and the time we would want to have the conversation and make those decisions. And so with that, I would just, I do believe, open it up to wonder aloud and see where people are. Diane.
Well, I guess I would just comment that I like the idea to move away from the term oversight because, I appreciate what Marion has suggested too, is in terms of equity issues, but the word oversight to me seems to indicate that we have a definite, what's the word? We have a definite, we cause changes at DCYF based on what we find out. And I don't believe that we do. To me, that's where I really struggle with the word oversight, because to me that connotes that we will tell them, okay, you need to do this based on our findings. And the reality is it's much more complicated. They can take into advisement what we say, but there's no direct impact of what we say onto their programs. So for that reason, I definitely like the idea of moving away from the term oversight.
Any suggestion on any of these sit with you that you see, any that rise or any other ideas that you have?
I've always liked the word accountability, and I think I'm not sure about the policy piece myself. Do we direct policy? I guess that would be my question for the group.
But the word accountability stands up and out to you.
I think so.
Okay.
Can you hear me?
Yes.
Oh, good. Yay. I like
And
accountability.
Tanya, you're next. So go ahead, Stacy.
Oh, I'm sorry. I wasn't sure. I was muted before. I agree with accountability, definitely. And I like advisory because that's kind of a proactive but a gentle way to, as you said, with all of our kind of expertise, to kind of give suggestions, advice, in a positive way. I like those two words a lot. And I agree, a policy, we can't really, I don't think we can really do that.
Okay. Tanya, thank you.
I guess I'm just going to pose a couple questions. So for me, well, first of all, I just want to say I don't like monitoring. I just think there's pretty much anybody who's been impacted by a system has been monitored somewhere along the way, and it just doesn't feel or sound right to me. And then I guess my question is the advisory, accountability and advisory. I like the sound of that, but do we advise? I mean, how is that? I guess it's a different level of the oversight. So now we're advising. Do we do that?
Good question.
That's all I have. Thank you.
Yeah, no, appreciate that. Lisha, I see you had your
I'm happy
wiggled
to
your
jump
finger,
in.
and then Pamela, you're up.
Yeah, so I think historically the board's primary way to advise or facilitate some sort of accountability process has been the annual report, where we review these 18 outcomes and say, look, it's getting better. Look, no, there's no change, or yeah, something needs to change. So that's been the primary vehicle, I would say, to date, for advising, for example, in my perspective. So I wanted to get back to you on that question.
Okay. Pamela.
I like the term accountability and advisory because seeing what everybody's input has been, I would say each, like we mentioned multiple times, that each of us have a bit of advice through our work that we provide. And the accountability piece, I like that because obviously when we do provide input or work, we're trying to hold these agencies accountable and bettering the system. But I don't have any other, like, if anybody else has any other suggestions, I'm open to viewing them, but for right now, I think accountability and advisory is the top of the list for me.
Okay. Yeah. Thank you. Appreciate that. Other thoughts?
Yeah, I'm going to echo Pamela. I completely agree that if we are wanting to partner with DCYF to provide our lived experience and our expertise, advisory is kind of a key piece of that. Accountability, I get a little bit worried. Like, I completely agree with everything that's been said about accountability. But I do get a little bit worried that the public might construe that as we're kind of like ombuds, right? So making it clear that that's not our role if we're saying accountability is part of the name of the board.
Any thoughts, Danielle, on any other words that kind of you've been thinking of, or that kind of would fit better?
Not necessarily, which is
Okay.
kind of like a hang up, but I do really appreciate the advisory piece of things, just because that's what we want to do is advise and guide and help with that accountability piece in a constructive way. So I do appreciate the accountability and advisory.
Yeah. Thank you. Rep Dent.
Thank you, Senator. So, it was quite a discussion on our very first meeting in Ellensburg of this board about the advisory term. We're not an advisory board, and there's a lot of advisory groups out there, and folks, that does mean, well, we can offer some advice, but you don't have to take it. And if we're truly going to have any teeth in what we do, then we can hold people accountable or oversight, whatever we determine. And there are other words out there. I'm not a wordsmith, but and I think that's good. But I think advisory weakens our position and lets us know that we can offer advice, but nobody cares. And I think I don't think that's what any of us want. I think we want to be able to stand up and say, this isn't working. How are you going to fix it?
Any thoughts on, besides oversight? And I don't know where you sit on that, but any other words that would not weaken you believe the kind of the nature of the work of the board?
I don't have any today, but I'll tell you what I'll do. I will have some in a few days, you know.
Okay, would love to know. Awesome. Bobby.
I just want to second the emotion in the motion of Rep. Danton. That is that we did have this, shall we say, a little bit of a struggle early on when we were kind of, I won't say ignored, but underestimated, I guess, maybe, or ignored in some respects. With the idea that there's, 20, I'm making that up, but there are a lot of other advisory committees, et cetera, that pertain to the work of DCYF. And this is different, and it's meant to be different, hence the word oversight. So I get the necessity for rethinking that word because of its historical antecedents. But if we're either going to throw back in advisory, I think that does diminish us, and we should not be. And I think that's not the intent of the initial legislation. And the second word better be something like accountability, because otherwise we don't have the kind of teeth which would indicate that, we're looking at data. We're trying to do that better. That's part of 2.0. We're trying to take a look at what the health and welfare is of the workforce. That's 2.0. And if we are not perceived to be a group that has the authority to hold the department accountable, at least in some way, whether that's in the court of public opinion or otherwise, then we completely undercut the idea of having a quote unquote oversight board. And I, for one, would think that was a terrible idea.
Ruth.
Thank you, Senator. Well, I just want to second what Bobby is saying. The function of the board has always been to look at outcomes for children and families and to really try to measure whether the department is achieving the vision the legislature had. And I think accountability actually captures that and is a good new name for the Oversight Board.
So just accountability board, DCYF accountability, or is there any
No,
other
I
term?
think just accountability from my perspective.
Okay. Judge
My hand
Amamilo.
is raised. I put some words in the chat because I was
see
driving.
Yeah, okay. Go for it. Oh, you're driving. Okay, don't
I
go
was
for
driving, so I put some words in the chat.
it. So I see ethics and I see governance as two suggestions for the board. Thank you for adding those. Anna.
I was looking at the DCYF. They do have advisory boards, so I'm curious if this would kind of lump us into that same group. And I do sit on a lot of advisory boards, so I kind of know my role as an advisor. The accountability sounds like it has a lot more responsibility. And I can tell you right now that this board has a lot more responsibilities than I have as just an advisory board member. So I have to agree with the accountability, utilizing that. I was kind of thinking the same thing with ethics, because with accountability, there is going to be advice, even though it's not in the title. It is something, because that's what accountability does. When somebody's overseeing that accountability, they have to be able to advise on what's missing, what needs to be done, what needs to be improved, how, possibly given, the board makeup of the different types of experience and expertise you have. So my vote is just accountability.
Appreciate that. So I'm hearing a starting theme that advisory really does not meet the function of this board, but there seems to be some agreement, and it also, I heard, really weakens, if you will, and could weaken the not only the work or how others would view the work that we do on behalf of children and families. I'm hearing from a group a theme of accountability is a stronger word and is more in line with what our function may be currently as we think about our 2.0 iteration and the work we're doing. Other thoughts, and I see Dr. Levy, who is the acronym queen, says DAB is a nice acronym. So
we can do it with just one A, I might add.
yeah, so it'd be a single A, DAB. But DCYF Accountability Board is a suggestion. Any other conversations on this?
I would just say what I'm really appreciating is that we all seem to be very similarly looking at this. And I think that to me means that these discussions that we've had over the past year, where we've really been talking about our scope and our mission and our vision, is really coming together as a group.
What I would say is if there are other ideas that come out of or are sparked by today's conversation around the name, that I know I would appreciate, and others that you would perhaps continue to send anything to Lisha and to Nicholas. And then what we would do is again in December, perhaps then do a vote on the name, and no, the name as it currently exists in this draft is only a draft. And that we would perhaps do two things. One is have conversation around the draft on the legislation, and the other would be to finalize our discussion and decision around a name change that would go within the body of that legislation. Is that an accurate reflection of a process that would work for folks?
Yes, I think.
Thanks. I
Yeah.
see head nods, and it still allow for folks other ideas to come forward. And if there were new ideas, what I would hope would that they would come out to us. So anything that might come into Lisha that would be something that additional we would want to consider besides the alternatives on this slide, that we would know that and be able to consider all ideas from the board that might come forward before our December 17th meeting, if that makes sense.
And I'm happy to facilitate that and, solicit some more further suggestions.
Some of us do better when we go off screen and chew a little on things and look at words and look in the thesaurus and all kinds of stuff. So don't want to believe this is the last shot at all. But really, I also appreciate the conversation and the consideration to make sure that we're actually calling ourselves who we are and what we do. And there's always room for that ongoing conversation. Any other things? Did I forget anything, Diane or Lisha?
No, I think you covered it all. Thanks.
Okay, thanks for sticking with me. Concrete sequential is what I try to be, and some days it's harder than others. So anyway, with that, I think what I'm going to do is pass this over to Lisha, correct?
Yes, that is correct.
Okay. Woo,
Happy
okay.
to take the baton. Yes. Okay, so we are switching to another item on our agenda related to an extension of the current co-chair's terms. And this will end in a vote. Now, a question is, does it make sense to have the current co-chairs present, or I'm just wanting to throw that question out to folks. We didn't spend some time deliberating ahead of time, so I just want to share that.
I would be happy to go take a little break if people want to discuss this without us present.
Yeah, I would be happy to.
Okay, and then just for context, Nicholas just let me know that in previously when there was a co-chair extension, people were present, the people being, so just wanted to share that as well. Rep Dent, I see your hand.
Yeah, I think it's okay if the co-chairs stay in the room. I mean, they have whether they want to say anything or not. I mean, it's we're all in this together, and it's not like the chair is it's not like we're voting for the president of the United States or anything. We're just you guys having been a chair, I get to preside at the meeting. That's what happens, and then most of the rocks are thrown at them. So I think it's okay if they stay in the room.
I agree.
That makes good sense to me. Okay, moving forward, no break. So I want to let the board know that following the board's bylaws, next month, the board co-chair terms for Dr. Diane Levy and Senator Claire Wilson will end. And I asked both co-chairs if they would consider for another year. And so that would be through December or mid-December 2026 if the board supports this. And I want to provide a little bit of context because I think that's important. So a 1-year extension was previously proposed and approved in 2022 under co-chairs Rep Dent and Sharonda Selovanoff. And the reason for this extension was that, just to provide, again, additional context, the former executive director was on parental leave, which was stopping meetings from occurring, in addition to the pandemic, as well as there were serious delays in appointing new board members. So the board members passed an extension, and in so doing, postponed electing new co-chairs until more members could participate in the selection process. The current co-chairs have concurred that an extension might be optimal to minimize disruption and the current momentum that we've really experienced. I also want to share, and this is not in my notes, but I believe in 2024, when I was hired, there were 3 board meetings during that time. So I was hired in August of 2024. And of those 3 meetings, only one was an actual, what you would call traditional board meeting. The other 2 meetings were specific to the hire of the executive director. So that is prior to my start in 2024, there was essentially 1 board meeting, which occurred in March. So to some extent, their ability to really function as co-chairs in this capacity, in their role as co-chairs, was curtailed. So so basically I am proposing that we extend the co-chairs terms by 1 year until mid-December 2026. So they have an opportunity to complete a full 2-year term. And I'd like to open the floor for discussions and reactions to this proposal. Ruth.
Well, I completely agree. I think, the fact that we did have another hiatus and didn't have a functioning board with the chairs performing their traditional role. I do think that the current chairs really have a clear vision of where we're going, and it would be very helpful to have, and I'm very grateful they're willing to serve for another year to continue to provide the leadership. So I strongly support this proposal.
Thank you, Ruth. Rep Dent.
Thank you, Elisha. So having been the chair who was extended one time before, we did it. We come out of we come out of the pandemic, and we might say we were struggling with being real functional, and but I don't think we did the right thing. I think we might have been better to transfer it like it says in the legislation, and so I'm a little hesitant to support this, and I'll tell you why. Is I think we have a lot of qualified people on this board that could slip into these roles and do this. And I think I don't want to see them miss that opportunity to chair or co-chair this committee. I think that's important. But I also think it's important that we follow the rules. And having been the guy, like I said, that did it before, I think we did the wrong thing. And I don't think we should have done that. I think I should have stepped aside. I should have said, no, we shouldn't do this. We should put a new chair in place. So that's my feeling. I just think it's, I know we're doing a lot of things right now, but we're all up to speed here. I think could transfer just fine. And then we keep some continuity going and a respect for the rule of law, which is the legislation that created this. And I think that's an appropriate. So thank you for listening to me again.
Of course. Thank you, Rep. Dent. I see Shelley's hand is raised.
Well, as a new member to this board, I would love to see the leadership continue forward until I'm grounded in my place. That's selfish for me, but I'd like to see that continue. Sometimes when you bring new folks to the table, the whole direction can change, and I'm just catching up still. So my vote is to sustain our leadership.
Great. Thank you so much, Shelley. Ruth, I see your hand.
Yeah, I just want to clarify that the 2-year term is in the bylaws that Bobby and I wrote. It is not in the legislation. So this is very much within the authority of the board to determine whether we want to extend this or not.
Wonderful. Thank you, Ruth. Mary, I see your hand is raised.
Hi, yes, and I'm a non-voting member, but just wanted to add in my 2 cents, which is that I feel like Dr. Leiby and Senator Wilson have done a really good job around kind of leading the 2.0 conversation. I feel that we're nearing kind of completion of this, but we haven't quite landed that plane yet. And so I think there's value in retaining the leadership that have really kind of been instrumental in guiding that conversation with the Oversight Board.
Thank you so much, Mary. Other thoughts? Questions? Additional concerns?
Well, I'd like to go ahead and move that we extend the 2 existing co-chairs for an additional year.
Okay, thank you, Ruth. Does anyone second that?
This is Lois. I second.
Thank you, Lois. So I am going to proceed with a roll call vote and read the list of board member names one by one. When I call your name, please unmute and say either aye, nay, or abstain. And at the end, we will count the votes. So I'll just start with the names. Judge Sharonda Amamilo. She was driving. So I'm going to keep going. Anna Armstrong.
I vote aye.
Yes. Aye, nay, or
Yes.
abstain. Great question of clarification. Representative Steve Berquist.
Aye.
Thank you. Katie Byron is absent. Bobby Bridge.
Aye.
Thank you. Senator Leonard Christian is absent. Representative Tom Dent.
Representative Dent votes nay.
Okay, thank you, Rep. Dent. Dr. Ben DeHaan.
Aye.
Thank you, Ben. Pamela Javier.
Aye.
Thank you, Pamela. Danielle Johnson.
I'm going to abstain.
Okay, thank you. Ruth Kagi.
Aye.
Okay. I'm just looking at, we have a co-chair name next, and I think so I'll just say your name and you feel free
I'll
to abstain.
abstain.
Perfect. Thank you, Dr. Diane Leiby. Lois Martin.
Aye.
Thank you, Lois. Tanya McClanahan.
Aye.
Mary Spruti Garlant.
Do I vote on this motion?
Oh, I'm so sorry. You cannot. Thank you I was just going down my list, and this is not a roll call, so your name should not be on this list. Thank you. You cannot vote on this. Thank you for keeping me honest. Stacy Williams.
I vote aye.
Thank you, Stacy. Shelley Willis.
Aye.
Thank you. Senator Claire Wilson.
Abstain.
Wonderful. Thank you. Nicholas, do you have the count of the ayes and the nays and the abstains? I believe there are 3 abstentions, 1 nay, and I don't have the aye total at this time.
12 ayes
12 ayes. Thank you so much, Senator
and 3
Wilson.
abstentions.
Okay. Okay. So that's majority, and we are over quorum. So given this, the co-chair's term will be extended by 1 year. Congratulations, and thank you for taking this on yet again on behalf of the board and children, youth, and families in Washington State. We now have 1 item left on our agenda, which is just to debrief this meeting. This is something that the board used to do and it's kind of fallen off the agenda more recently, and we're hoping to bring it back. Before we jump in, I do want to step back and really thank people for such a great meeting. I thought we had really great engagement and lots of participation, which is wonderful to see, and really appreciate everyone's feedback here today. So before I open it up, I just wanted to see if people, as part of the debrief session, wanted to share maybe 1 or 2 key takeaways from today's meeting. So, for example, what stood out to you as important? What would you like to know more about, or next steps? Do you have any questions about our next steps? So with that, I will open it up. Anna.
Yeah, I'll quickly say I enjoy your homework assignments. It really keeps me focused because I have a full-time job. So a lot of this stuff is what I do on the side. So having direct objectives for each meeting is amazing. I, was Googling, the House Bill 1227, the Senate Bill 6109, all these things. And when you're talking, I'm always, because I don't know a lot of the acronyms, but what I know when you were talking, you had your slides up there. And I don't know if it's just the kind of learner I am, but I was kind of getting lost. Like, what were those objectives again? So visuals are really helpful for me. It helps me to stay focused and kind of remember what we're talking about at the moment. I mean, I like seeing your face and everyone else's, but just I enjoy the way everything's put together. I do sit on a lot of different boards, and I like the organization that goes behind this. I love the dialogue also. I mean, being able to listen to, everybody. And I did Google Representative Dent and Senator Wilson and Judge Amamilo. So just because I'm like, okay, I want to know a little bit more about these people. But, seeing things, to me, I'm a visual learner, I guess, not only hands-on, but visual. But I appreciate everything. I love the dialogue that we have, the knowledge and experience in the room. And I really appreciate the opportunity to be heard. And I also like to be called out every now and then because it really keeps me engaged. I can't get lost in myself. I can't hide in the shadows because I know somebody sees me and somebody's listening to me. So I appreciate that also. And I don't know if that comes from you or it comes from our 2 co-chairs, but I appreciate the work that we're doing here, and also just the camaraderie that happens when we get together. I thank you guys.
Oh my gosh, thank you so much for that feedback. I really appreciate hearing that the homework was helpful and kind of unpacking, like, what does 6109 mean? What does 1227? That's great to hear. I really want to empower board members. That's something that's so important to me. And then visuals. That's something I will reflect on. I mean, I think we could have clearly specified, objectives within each section of the agenda and have that more front and center. So I'd love to talk with you more about that. Thank you so much, Anna. I see Stacy's hand is up.
Yeah, thank you. I agree with you, Anna. That I love the homework, and every time I saw your email, Alicia, I'm saying, "Oh no, more homework." I was quick, looking at and accessing. It's like, it was great. No, I loved it. Also, in terms of the presentation by DCYF, the acronyms drive me crazy. If you guys can give us, please, what FTE means, what, please, because I love following it, but I have no idea what some of those things are. It would help to know so that we can follow it. I mean, yeah, that would be great. Helping with that. I love the conversations here. I agree completely. Representative Dent, and the historical knowledge is wonderful to understand the clarity of from all of you guys that have been through this a lot. It really helps for us to inform our own decisions and just to understand what the process has been over the years around this committee, which I feel honored to be part of. And I agree, the camaraderie of this group, it's really lovely to, even though we're online and doing the Zooming thing, which I hate. As Anna knows, we're used to being part of tribal community, to sit around a fire or a lodge or something rather than this crazy computer. But even the essence of connection seeps through the screen somewhat. So I appreciate to be part of this. So thank you.
Thank you so much for sharing. And I will connect with DCYF about that with respect to slides. And then we actually have an internal acronym list, which I do not think we've sent out in quite some time. So it's a work in progress. So but we'll be sure to get that out shortly to everyone. Thank you.
If I could offer AOC, and which is Administrative Office of the Court. Sorry, it's been a long couple days. And Lived Experts got together and created an interactive acronym app and list on their website. So you can access at any time. And if there's ever like an acronym that you use or you hear of that's not on there, they encourage you to add that or to send it in. And so it's something we worked on for about a year and a half.
I love that idea. It's dynamic, right? It's not static. It's not me just sending a piece of paper and then it's going to be outdated in 3 days when someone finds another acronym. So I will look up where that is at, on the AOC website. Thank you so much for sharing that. Stacy, your hand is still up, but I don't know if you might have another comment. It looks like you're trying to bring it down. So I just want to give space for other folks who might want to share. Okay, well, I see Ruth.
Well, I'm sorry that I had to miss the first part of the meeting, but I just want to express a lot of gratitude to our two co-chairs who have dedicated a tremendous amount of effort into really trying to revision what this oversight board could be and working with all of us to get us there. So I really want to thank them.
100%. Thank you for that acknowledgement. Lois.
Sorry, all, I guess, Ruth, we're in the same boat. I had to miss the first part of the meeting following the task put forward to by Senator Wilson and Representative Dent around the early learning workforce group. And so we had to meet. I had a conflict. But I wanted to thank Lisha and Nicholas for always keeping all of us in the loop, and the extensive notes that they take made me feel confident that I would be able to catch up on what I missed and still have a place after the fact to be able to share information. So just wanted to thank them both for their hard work.
Thank you so much, Lois. And Nicholas and I appreciate that. We are a team. So Tanya.
Yes, I kind of just want to say along the same lines. I just feel like just this young, fresh sponge, as a lived expert, just absorbing everybody's knowledge and everything that's being brought together and the work. I don't feel like I'm just sitting in a chair as a token. I feel like there's actual attention and work being done. And I just want to say, coming onto a board like this with some pretty high up people, that Lisha and Nicholas has made a very smooth transition. And they're two of the most responsive people when I reach out to them. So I just want to say thank you very much for that. I appreciate it. It's made it a lot easier for me to sit on this board. So thank you.
Thank you. Really appreciate that. Any last comments before we move to our closing remarks and adjourning? Okay, so I will turn it over to Senator Wilson. Thanks everyone for
Thanks
participating.
so much, and it looks like we're gonna have a little recess, recess was always fun for me when we got done early and teachers said, okay, you can go out and play. I'm like, oh my gosh, so doesn't happen that often. And I just want to say thank you so much. And the faces on the screen mean a lot. We had full tables at the retreat, which was awesome. And a lot of energy and just really just deepest appreciation for your input from all sides, because it takes all of us to do this work. And the whole goal is to get to neutral so everyone can move ahead together. And sometimes we're in first gear, sometimes we're in third, and sometimes we're in reverse. But as long as we're coming to the table and having the conversations we're having, I think it's all for the good. So I just wanted to just say that, and for the input and the willingness for people to share. The other thing I just wanted to do one update, and that was that we have had the Family Separation Task Force, come and share with us what was going on as the Oversight Board. And I wanted to make sure that folks knew that that body of work is now moved out from underneath of DCYF. And a new subcommittee on immigration has been created that now sits under the Office of Equity. And so the work will continue, but broaden as far as, especially as we think about just all of the work happening and responses, not only session-wise, but also from a federal administration, I think. So just wanted to FYI, because I know Lillian had come and presented, and we'd done, just some exploration and shared resources, and the continued work happens, but it'll broaden, not forgetting kids and families, but sit under the Office of Equity. And so again, just an update on that. Thank you, thank you, thank you for sticking with me through the chart. And I'm going to pass it over to Diane.
I've been sitting here reflecting on just what a lovely group this is, different viewpoints, and people are just so willing to be engaged, which I truly appreciate. I think that sometimes the work that we are listening to and the work that's being done, it's hard, it's challenging. We're hearing sometimes some negative outcomes for families and children and individuals. And I think that I just really appreciate people's willingness to be here at the table and trying to make things better for children, youth, and families in Washington State. I also just want to personally thank you all for your confidence in allowing us to continue for another year. We really appreciate that, your vote of confidence, and we'll try and do our best. But this will be the last extension, so get ready, whoever's going to be the next community co-chair. That's it.
I think with that, unless there's anything else for the good of the order, it is 12:22, and I won't keep anyone for any other reason. And have a great rest of your afternoon, a good weekend, and we will see you in December.
Happy Thanksgiving,
Share your
everybody.
thinking.
Happy Thanksgiving.
Yes.
Bye, everyone. Thanks so much.
Bye-bye.